everything go good with the boss?
Yeah, it's
Getting a promotion?
Well, that was sleeping long hours with his dog.
There you go. He was gone for 2.5 weeks.
It's a little different now. Jim's not there.
Wilder?
I'm sure.
It's been the last 25 years there.
Yeah, it's always a big change.
Yeah. To be honest with you, right now, I really haven't noticed a change. So,
It's not like it's always full. I talked to Michael, and he said, he's just a smooth transition. And he said,
yeah.
people in Watertown,
Yeah,
Watertown, I'll say, I like it. They should go and see it there. I don't know, just like how to take that.
Yeah. Rapid, yeah.
Open it up internationally or
Yeah,
nationwide and
right.
bring some guy into a lady that run it like a for-profit business.
I just met
They went to, I think,
Sophie for the first time in a couple of weeks now. Man, she's really young. She's been in
oh, this is maybe, it's, for the mileage, I guess, that's what they had that.
A lot of things she needs to
straight out of college.
And I don't know if it's properly.
yeah.
I was wondering.
Yeah, the GIS person there. I start shaking my head. You know, like he left in 3 weeks. Assessor getting split stuff.
Sure.
He's leaving for 3 weeks. He says, you know, after 5, the day he leaves. I was like, I need the data. So we didn't go to, but got on the computer, opened his project, took it, fixed a lot. Made all the splits. And I told her, it's back. We looked our data. Well, he left the topology rule in his project with that pointing to a 2-month-old road. So he kept screw this one. So I had him send me those parts. I don't know what the problem is.
Yeah.
I thought you were sitting down.
We gotta declare it, so. Is it leak or is it just fall out? I mean, it's still runs good, yeah.
Mike said he's gonna try to find a window. Because the windows don't go up. He was gonna put it up and tape it, block it up so that.
Let's just sell raffle tickets for, hey, we'll donate it to the Boys and Girls Club and they
Yeah.
can raffle off a 20-year-old car.
I know. And Mike can explain more because he just told me it's.
We're lucky. We got a guy like him. Good guy. for health insurance.
That is.
But I think they're $3,600 a piece, and then they go 1 week to year 2.
Oh, John, you don't have to, just say you're moving item 20 before the health insurance? Or after that? Before.
I'd like to call. Gary, are we ready? You ready, Gary? I think you're ready. Gary? Okay.
Microphone's on.
Please, I call the meeting to order. Everybody please rise and join me in the pledge. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation under God, indivisible, with liberty and justice for all. Patty, you want us to take the roll call, please?
Dan,
Here.
Wanda,
Here.
Ryan,
Here.
John,
Here.
Don.
Here. Is there any reason that any of the commissioners would like to abstain from voting on any issues before us today?
No for me.
Because of conflict of interest.
No.
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 I will abstain from the second set of claims as it relates to my office.
Okay. Next item on the agenda is approval of the agenda. We would like to move item 21, which is a conservation manager position, to the next item on the agenda.
I would move to approve the agenda with that change.
Also, we can strike item 6 from the agenda for tonight.
Item 6 is off.
Yes.
Move approval of the agenda with the corrections.
Second.
Have a motion and a second. Further discussion? All in favor say aye.
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 Next item on the agenda then would be vehicle for DOE, and we've eliminated that one, so item number 7, the nurse.
Mr. Chair, let's do item 21.
Oh,
21.
Come on up.
okay.
Gotta save the
Yeah.
public comment.
Oh, yeah, I'm sorry.
Public comment too.
Public
Sorry.
comment first.
Oh, it is not there.
I apologize. We got to do public comment. I jumped the gun. So sit
Public-
right there for a second, and
It'll
he's got
just
to
take a
open it to
minute.
public comment.
Public comment is a time for persons to address this body on any subject. No action may be taken on a matter raised under this item of agenda until the matter itself has been specifically included on an agenda as an item upon which action will be taken. Each person has up to 3 minutes to speak. There will be no personal attacks against the members of the body, county staff, individual, or organization. The chair has the authority to enforce this policy. Failure to adhere to these rules may result in forfeiture of the remaining speaking time. Does anybody wish to make a public comment? I do. Ryan?
Did you put your name on here?
Sure.
No, you can put Brian. They were here.
Brian, you wanna go first then?
Thank you, Mr. Chairman, Commissioners. This is Doug Saul with me. Some of you know Doug, I'm sure. About 20 years ago, I was on the commission at that time. We had just moved in here, and Doug was the director of the museum. And he did this beautiful photo display we have out here in the hallway. There's 10 historic photos of various landmarks like the bridge and the courthouse. He did it for a bargain price for us. Well, first of all, he picked out the pictures, took them to Harold's, got them sized, then he had the glass cut, and he went to Hobby Lobby and he got frames on sale, and he did that whole display for about $500. I'm not guessing we could do it for that today, but he does know how to do it very reasonably, and so we're here to ask to be put on the next or a future agenda to possibly do another display of about 10 photos. Some of the landmarks that we had in mind were the old post office, the Bishop Marty Chapel, the Masonic Temple, the Gavins Point Dam, Mead Museum Building, Dakota Theater, and I'm sure we can think of others, GAR Hall possibly. I just wanted Doug to explain the process, and if you're in favor of it, we'd sure like to get on an agenda for official approval.
Thank you, Brian. It was 20 years ago. Yeah, and I was at the museum. And I don't remember who, I think I approached you all with an idea. And I got the go-ahead. Involves the 10 pictures you see out there. But I always thought we could do a little more. But I never quite got around to, and here 20 years goes by. And that's when Brian called me, and I thought, this is a good idea. So I came over here and looked around again and got some ideas. And I happened to be going to Sioux Falls one time a week or two ago, and I stopped by my favorite place. Why do I go to Hobby Lobby? Because I can hit them at 50%. I'm serious. To give you an example, those big pictures out there are 24 by 36. There's 3 of them. That's relatively large. They have them up there with glass for $89, but they're only 45 when you hit them right. Now, you cannot get a picture that size for 45 bucks. So anyway, it goes down then to the smallest ones. And the only thing we haven't quite, you heard some of those ideas he had, we haven't laid out, you know, the sizes and whatnot, so it's a little hard to budget because they range from that $90 down to $30, $45 down to $15. We didn't have to pay anything for the photos because I had all the photos at the museum. So we would have to gather those. We would have to get them duplicated. Now, unfortunately, Harold's used to be here, and that's who I used. So this would probably involve taking them to Sioux Falls, to Harold's, or whoever, and having the photos duplicated, and then everything else that goes into framing something. Now, I did that all myself. As a matter of fact, you might love this. Old Bob Hansen, that some of you may know, sat there in the center, and I got up there, and I'm drilling in that wall. And I'm not comfortable drilling in the brick wall. But that's what we did. He sat there going like this. I'm sure we can get that done because I don't know if I want to do that again. I would like to kind of be more involved in the organizational part, and I would help assemble these kind of things because we brought the parts together and did it here. This would probably cost you in the neighborhood of, my guess would be about $25 if you took it somewhere. It could even be less.
Sir, your 3 minutes is about up. So,
Yes.
So would you wrap it up? And
That's all I have to say.
And I think
I
you
think
can cover the other things when you come to the meeting. And by the way, Althea Higgins contacted me on the possibility of the post office as a picture. So
I've not met the lady, so
you have met her?
I'm not.
I
No.
have not. Okay.
Mr. Chair, I'm in favor of them putting a proposal together and getting on a future agenda, so I think that's a great idea. Thank you.
Everybody is?
That's
Thank
it.
you.
You bet.
Thank you. The 10 pictures we have out there, they get a lot of viewership. People
Yeah,
are constantly
do.
looking at them, so thought we'd give them a few new ones to study. Sure.
Okay, I'm Christopher Patton, resident of Yankton, and elected GOP committeeman. And I'm here primarily, first of all, to thank you all, those that have come, whenever you've come, some of you more often than others, including Sheriff Chrissy, to our Republican monthly meetings, where you've been able to share your challenges, successes, frustrations, and you've given the people in attendance a chance to ask questions, and you've really engaged. And I want to remind everyone here that these meetings are open to the public. It's the first Monday night of the month. Next one's December 4, 6 p.m. And please do come, and you will get a chance to be able to ask questions that maybe you can't during these meetings, and that will help you to understand the challenges that these folks faced. Now that reminds me, there was a song in the 60s that sort of relates, because I listened to you guys, and when I woke up this morning, you were on my mind, yeah. You were on my mind. I got troubles, oh, I got worries, oh no, I've got wounds to bind. Yes, you do. And what was hitting me was the fact that the state requires you to pay the medical care and doesn't give you access to funds for the indigent people. And I had an idea when I woke up this morning, and I thought I'd share it with you. And I think it's very important to deal with this issue now and to start thinking about it, because given the irresponsible and foolish decisions of our federal government, we're only going to see more of these kinds of issues. And what I would describe it as is treatment and relocation. We should treat the people for their immediate needs and then relocate them to a facility where the state provides the funds to adequately take care of them. And this is really an ethical thing. We're dealing with the people. And I want to remind you a little bit on our tradition and our culture. The Gospels say that if you have two coats, you give one to someone else. It doesn't say get rid of the coat that you have, because that's just going to cause more problems. You lose your own coat. And that's what the federal government right now is doing. It's ripping up its coat and shedding it all over the place, and we're going to be faced with these consequences for many years. And so I think this is a way for you to come up with a policy and look forward in dealing with that, so that when you have people that are not economically viable, either as a person or as a family, you can move them to a place where there's resources, where they will have help, and not overly strain this county. Because it's not right. It's like an indirect tax for the state to put that on us. And we don't want to raise more taxes. So just consider that in the right time and place, and thank you for the time.
Hey, thank you, sir. Anybody else for public comment? Hearing none, public comment closes. Now we'll go to item number 5. County health insurance renewal. Julie.
No, I thought we were gonna do conservation
Oh,
manager,
Now.
number
Sorry.
21.
It's too hard on me. Item 21, conservation manager position.
So, the Conservation Board met last Thursday,
No, I think it was.
2 weeks ago Thursday?
I interviewed on Monday.
Monday,
I
okay.
think you guys saw Tuesday.
Time flies when you're having fun. Anyway, the previous conservation manager left, and so they needed a replacement, and they chose to recommend to us to hire Ryan
That is right.
Strickland. Stickney. So I would make a motion that to approve their recommendation to hire Ryan as our new Conservation District Manager.
Is that a motion?
Yes.
Second.
Have a motion and a second. Discussion? Hearing none. All in favor say aye.
Aye.
Opposed the same.
Welcome.
Welcome.
Thank you.
Tell us about yourself.
Well, my husband and I moved here for his military job, and he retired after 29 years, and now he is the VSO here. I was doing Amazon before this, and I just needed something a little bit more grown up. I'm a little nervous coming into it. I've done farm bookkeeping before. This is a little bit more in depth than trees and grass, and so I've got some learning to do. But I hope, while Sarah's still there, she can teach me as much as she can.
I'd like to see a game plan put forth that lets the entire county community really know and understand the options that are available for them in the conservation area.
Sure.
And I don't think that's been widely spread.
I don't think so either.
We're fortunate, we're one of the very few counties that still has a soil conservation person, and I think that's important that we showcase that.
Yep.
Great idea. Welcome.
Thank you.
Welcome.
Welcome.
Thank you.
Now we can try the county health insurance renewal. Oh, Julie, oh. Oh, I'm just kidding. Sorry.
Oh, it's all right. Well, I'm bringing good news. Great news. No, not really. I'm being sarcastic. See, Don? Once again, it's that time of year to renew your health insurance. Of course, we were looking at, last year we switched to Medica from Wellmark Blue Cross Blue Shield.
Which one are you on? Are you on one of these yet?
You're gonna start with the beginning, and we'll just kind of move through all your pages. And last year, when we decided to go with Medica, they had given us something called a storyboard, and that's what this is. It starts with the front page, and we'll just flip through it and kind of go through why you are seeing such a ginormous increase, because they kind of had promised me about 7%, and here we are looking at 29. So, average rate on the current plan was right around $757.43 with a family average of $1,887.43. And then it just goes into the demographics of everyone on the county plan. And currently you have 75, it kind of bounces between 73 and 75 employees on the plan.
And that's the monthly rate that it costs the county? Is that monthly rate it costs the county?
Correct.
So everybody knows, $757 for a single family is $1,887 per month.
Correct. So it bounces between, like I said, 72 to 75, and when this storyboard was put together, it was from January through, I want to say, May. Okay, so it just takes so much time to compile all the information. So now I'm on page 3, and if you take a look at the premium that they had collected for those 5 months, the average premium per employee would have been $696.23, and that employee and family, so that's all the people on the plan. And if you want to take a look just down the row, physicians, ancillary, and these are the bills that were turned into Medica over those 5 months. Total incurred health costs, $531,289. A price per employee or per person on the plan of about $1,241.33. So, health insurance is based upon risk and expense. And if you then move over to page 4, of the 5 months, an average of right around that 74 employees. January, there were 73, February 75, March 77, 74 in April, and 75 in May. 374, you divide that into the premium collected, $696.23. That's where they basically came up with those numbers. Incurred health costs, $531,289 compared to the $297,000 of premium. And that's where they came up with a $1,241 cost per person on the plan. If you flip it over to claim costs by category.
Is that $1,241, is that cost per person per month, or
Cost per person per month, yes, sir, yes.
Thank you.
If you flip it over to page 5, you then have total of expenses in network and then out of network. And I called about the out of network expenses, and basically they were pretty much written off. Quite a few of the employees, I don't believe any of the employees had to pay a significant amount of out of network expenses. There are just a few specialists that their services may not have been covered as in-network, and that's where those costs were incurred. Physicians, if you take a look at provider billed amounts, 903,000, copay and deductible amounts, 84,000, provider network savings, 264,000, and other disallowed charges of 74,118. Plan paid amounts, 479,725. And once again, this is kind of a smaller look at the entire year. In-network, 866,530, and the plan paid 478,000. So basically, some high expenses from January to May. And then if you want to kind of, it brings in even more of a scope into what exactly those charges were. Number of claims, 39 claims of injury, poisoning. I don't believe anyone was poisoned, but injury. Muscle, the muscles, skeletal charges, 111, cardiovascular, 36, neoplasms, miscellaneous symptoms, nervous systems. As you can see, all the charges and where those all kind of landed and where those actual charges were coming from on page 5. Inpatient and outpatient kind of signifies those. Then if you move on to page 7, where the injury of cost of 348,000 to Medica, paid amounts per member, 198,000. It moves on down, like I said, 621,781, and then Medica paid 378,490. So from the months of January to May, they're showing a loss of, over $200,000. So I guess that's where they decided to come up with an increase in renewal. From those 3 months, once again, was 531,289. And so they turned around and had planned on, and they showed me where they had planned on doing a 7% increase. Actually, we're looking at an overall expense of 57.6% of the dollars of premium spent versus, medical expenses spent per premium, and they lowered it to 29%. So they feel like they're giving us a deal. So, with that being said, I went ahead and looked for, and the last 2 pages are just terms, glossary of terms. And then the breakdown of the actual premiums of costs of last year, and then the increase is on the sheet that basically says Medica renewal rate summary for Yankton County. So currently your rates for your 5,500, which is the most popular plan, which is a copay plan, the cost to the county was, not the cost of the county because the employees do pay a share of that premium, $784.15, and it's going to $1,011.55. The HSA 6350 was $703, and it's going to $907. And the $4,500 HSA, which is the least popular plan, of $777.30, it's going to $1,272. So, went and asked for quotes from Avera, Wellmark, Blue Cross Blue Shield, United Healthcare, and Health Partners, and have not received a quote back from Health Partners, but according to their history and quoting, especially on groups of this size with this medical expense, they probably wouldn't be very attractive. So so you don't have to look through all of these if you don't want to, but if you can go right to the long sheet. And I've included. And that breaks down, you didn't get one? I'm sorry, Patty. I don't have an extra. Did you find it? Okay. If you take a look, and I kind of make some sense of this, I included in the blue columns the actual rates from Wellmark Blue Cross Blue Shield in 2022 when we decided to go with Medica in 2023. And if you take a look at those, they're only under $1 of where Wellmark is today on the same plan. And it is a little less expensive on the HSA plan. And I did eliminate the $4,500 HSA only because it's not as popular. And the premium was significantly higher from all the companies compared to the $6,350. And Wellmark and Avera do not offer a $6,350 HSA plan, so we went to the $6,500. Once again, when I turned in the rate history from the past 3 years, Wellmark's for 2022 and 2021, 2022, and then of course Medica's 2023, these were the rates that came back from Avera and Wellmark Blue Cross Blue Shield. United Healthcare was not competitive at all. United Healthcare. And so if you want to dissect these and visit about them, I'm more than glad to visit with anyone.
When are we gonna make a choice?
I do need to have it, well, Karen is retiring, and so I want to make it as, of course, we want to make the best decision for Yankton County, but I do want to make it as easy as possible for Patty and her office to get everyone transitioned and then to retrain. If we decide to do a different company, then we do need to have a little bit of retraining on how that's handled. And I will, and new applications, and that takes a little bit of time, which I will gladly help with, but it does take some manpower, so.
So the first meeting in December, you'd rather have it before that then?
I would say Patty would rather have it before then. I will do whatever you decide, but Patty, I do believe, would rather have it before then.
Everybody feel like that can work next meeting? Why not, huh? Okay.
As long as we get an opportunity to get some employee feedback on it, I'm fine with that.
Okay, and in speaking of that, I wanted to make sure you all had a copy.
And we haven't had any complaints on Medica.
I know, it's been very, very good coverage. Here, I just wanted, so you had this to take home with you and to look over. This is a copy of last year's, thank you. A copy of last year's employee sign-up sheet, and it was broke down exactly, the breakdown of what the employee would have to pay out of their paycheck every month per plan. And once again, the most popular plan was the copay plan, and then the $6,350 HSA. Because of course, the county takes the least expensive plan, pays 100% of the premium, and then the employees pay the difference in the other plans. So to help you kind of dissect what is actually happening with the premiums, this may be helpful. And I'm available for any kind of questions. And like I said, once again, I do not have to eliminate that $4,500 HSA plan. It is the least popular plan. It has always been the least popular plan. And it definitely had a large rate increase across the board with all the companies, so. Okay? Any other questions? I know, fun, isn't it?
The mood went down in the room
I
after I
know,
saw these
I know.
numbers. So.
Sorry about that. Okay, thank you.
Thank you. Chris, I'm really feeling that song you sung earlier right now.
I didn't mean to be.
Yeah.
Item number 7, the nurse quarterly report. Melissa? She's not here?
I think
Yeah.
We have some guests.
we have a few other.
Hello, thank you for having us. I'm Melissa Berg. I'm the dietitian manager for the WIC program. You've heard recently about our WIC restructure. So I know previously that I believe Jenny Weschler and submitted the quarterly report to you for the, I believe through June through October.
Quarterly, yep.
Yep. So from now on, as the dietitian manager, we will provide a quarterly report with the county. So we'll work with you kind of to see what we want to include in that quarterly update. So as far as for Jenny, we won't require her to come to the meetings. We would provide that information for you. So I'll work with you to see what all we want to include with that for data. I can tell you, we have 286 families that they served. This is September of 23. It kind of varies. It's varied from 274 to 286 in that range for the last year. So it's been pretty steady for caseload for the WIC families. Did you have any questions specifically?
Yeah, for the WIC position,
Yes.
you know, we have a county assistant, and so what is the state reimbursement to our expenses for that employee?
Yep, and are you referring to the new position? the
Well,
WPG
what are they
position?
currently, and then what are they going to?
Yes. So currently with the new contract, they are at $6.59 per participant rate.
Okay, $6.59
Yep,
per
and that's
person?
the June
Okay.
contract.
Okay,
Yep.
and what are they going to?
So if you choose to do the WPHA, it would be $8.11 per participant rate. And that would include, increased duties of that staff person also carrying a small
Okay.
caseload, a low-risk caseload.
What was your reimbursement to Yankton County last fiscal year for the WIC program?
Do you have that, Rhonda?
Okay, because I just wanted, $6, and, it seems that's pretty low reimbursement rate for, because we're paying the full cost for that employee in office and internet and phone and retirement and all of that to only get reimbursed, $6.55. That seems really low to me.
And do you
Even
wanna
if
see-
it,
do you
I
want
know
Rhonda
it's
for
going up to.
participant rates? Yes, and that
Yeah.
was based on that previous
So,
rate, that was in that other contract.
Okay.
So this 659 was an increase for the rate
Okay.
of living, the increase in cost for that.
okay.
Yeah, that was 7% increase for the 659, because previously it was,
Okay.
whatever, 7% less.
Are we able to negotiate a higher rate than that? Because inflation's not 7% right now.
No, so in the
Mm-hmm.
public health,
Sure.
in the public health assistance.
Please state your name and
I'm sorry, I'm Rhonda Buntrack, and I'm the WIC director for the state. And the public health assistant position is actually 2 grades higher than the position that's the rate is what that's figured on, is 2 grades higher than what the current clerical position is under. So that's the increase to the $8.11 per participant for the additional duties that they would take on.
And then with the change as well, then we won't be getting reimbursed anymore for the public health position, is that correct? Since we don't have public health anymore? Is that
Okay,
correct?
And so
That
that would
was-
be separate, or you're talking
Okay.
about for the nursing?
Yeah,
Yep.
Yeah.
Yep, so we would have.
Okay.
That is their.
I don't mean to
contract,
throw you
yeah.
guys off, but I
no.
just,
There's
so,
two
a lot of
different
changes in the
Yeah,
last
so
couple
we're
days.
looking at
so.
2 different contracts.
Sure,
So you
so-
have a WIC contract,
so-
and that one is
okay.
a reimbursed
So-
contract.
So the WIC, we got the group up here now. So the WIC contracts going, I mean, 7%, that just doesn't seem like, I mean, you heard our insurance is going up 30%.
29.
Okay, 29%, I'm sorry. That just doesn't seem like that's enough. And then when it doesn't keep up with inflation, then that affects all of our budget, and there's less that we can do. So, I mean, is there any negotiation, or is it 7%, that's what it is, take it or leave it?
That's what we have offered to all the
Okay.
other counties.
Okay, it just doesn't seem fair to me, I mean,
Yeah.
so,
I'm sure we could discuss that at some point, but.
okay.
Oh, sure.
Sure.
My name is Joel. I'm the Director of Community Health Services for the South Dakota Department of Health, Office of Child and Family Services. And I think some of the confusion comes in is with the contract that we had for the support for public health, nursing services. On that one, I can tell you that we're totally negotiable and looking to, with those nursing fees that you traditionally have been paying.
Sure.
Looking to make those more realistic to what is actually happening out in the community, and where we can alleviate that stress on the county, where if we can fund operations federally through grants, et cetera, we will do so. So that one we're undertaking a review of performance for those type of contracts throughout the state, and then myself and Wade Huntington will reach out to you guys probably here in December to discuss what those look like in the future, with the goal of decreasing what we're asking you to provide, and then just look at it, maybe support for space to come in and conduct operations.
It was Joel, correct?
Yes, sir.
Could you, we got a lot of people who listen to our stream here, and then those in the community. Could you just brief everybody on the board and the community what's actually happening to, what the Department of Health is doing to the county, well, it's really state, but the county nurse program? Because a lot of people aren't aware of what's actually happening.
Sure,
So
I
could
can
you
give
just
you
give a,
Yes.
a short synopsis of what's happening and why?
Yes, sir. Yeah,
Thank you.
so previously our office delivered service for WIC and some other public health nursing services together bundled, as, for lack of a better term, one service delivery unit. As the cost of nursing has gone up, to continue to use nursing workforce to provide WIC services has been a financial burden per se. As you guys know, the cost of nursing labor is expensive. To keep up with that and to also retain nurses and compete with other organizations is a challenge for anyone that employs nurses. So the WIC program had been over budget, so looking to alleviate that pressure of being able to enable that program to operate separately by itself, and in the future without necessarily a nurse delivering the WIC services that are needed, while at the same time allowing the public health nursing aspect of it to be engaged more in nursing related activities, and trying to deliver more of those activities across the state in a uniform manner. So that's what led us to having to pull the two programs apart at the root of it, looking not to compromise, the WIC program in terms of federal funding, and also looking how we can better deliver more of those public health nursing services through our office, which comes in the form of 3 domains: immunizations, school health services, and a pregnancy care program on a more consistent basis, and being able to engage those nurses more in those type of activities.
So for the citizens out there, the short answer is we used to have WIC and public health, and now we just have WIC. Is that, well, in the building here, right? Because we don't have a public health nurse in the building anymore, correct?
As of right now, physically present,
Yes.
that's correct, sir.
And so if we want public health, somebody will have to come from another county here. Is that an accurate statement?
Well, right now, another state employee will cover.
Yes.
Will cover
Okay.
this area.
So the county is not doing this. I just want to be perfect.
Yes.
Okay.
Yes, sir, that's correct.
But at the same token, we're not getting the same amount of service for the county health nurse that we were previously.
For
Because
those
we're only getting a nurse once a week.
For those particular activities?
Yes.
Yeah.
Well, Jenny Wishler's still here, but she's always mainly provided WIC
But
services.
she's not allowed to give any vaccinations or anything like that. She's not allowed to do any nursing procedures.
So if somebody comes in to see Jen for WIC, that Jen can no longer do vaccinations. That's an accurate statement?
Yes, sir,
Yes,
that's
I know,
correct.
yes,
That's
it
right.
is, of
Yes, sir.
course. it is.
Let me see if I can cut into this a
Yeah,
little
go
bit,
ahead.
because I had the same kind of question. After having read the job description for the new person, I didn't go and check item per item what the old job description, but can you tell me what things that the new person doesn't have to do that were covered by the nurse previously?
Here in the county, sir?
Yes.
I
Because
guess-
it appeared to me like we just took all the things that the nurse was doing and piled it over on the WIC person.
Yeah, we are asking them to do assessment, nutrition, education. and-
Everything.
Yep,
Yeah.
yep. But at a rate that is not quite at a nurse's salary, so that is part of what we're trying to do, is keep WIC in Yankton as much as possible, because the cost is so high.
And can you explain to this group why, if we're partners in this thing, why nobody here was ever contacted on this proposed change?
We did send a letter, but apparently that did not make it to you guys.
I've not gotten the
So-
letter, I've not talked to one county commissioner in the entire state of South Dakota who's seen it. Maybe somebody has, nobody's told me they've seen it, so. And to Don's point, it doesn't seem much like a partnership if we have no input on what's happening with our constituents, I mean. And then to the point of nurse, it sounds like we're getting rid of nurses for WIC, but Jen is a nurse, so I mean, what's her job future as a nurse doing WIC if you're trying to eliminate that? You're trying to eliminate nurses and go to health assessor or something like, what was the official title?
Public health.
Public health. So I mean, long-term, that nurse position is not gonna be there, right?
Well, we will keep the nurses as long as we need to keep the nurses. I mean, if they
Okay.
decide to find a different position, then we would reevaluate the position.
Sure.
But at the same token, we, at this point in time, do not have a nurse that can give vaccinations in this county at the moment. Who? Who's that?
Okay, so when we did the restructure, so we had staff is all in one, like an all-stop shop. And so what we had to do then is send out a survey to the staff for them to determine if they wanted to stay and provide the WIC services, or if they wanted to come over and provide public health services. So it was actually based on a staff survey, how staff determined which route they were gonna go, which domain or huddle that they would stay under. And so Jen Weschler is one that chose the WIC program. And with that, she was aware that those services through what she would provide for WIC and the ones over here with public health that she would no longer be able to do through the WIC program, and it's based on funding for that position. So right now we have, so it's been kind of complicated because the nurses across the state have been considered county nurses, but actually they're state employees, and the direction is given at the state level for them. So they're not necessarily owned by the county, but we've operated in that respect.
I understand
And so right now we've got Tracy Smith, who is in Tyndall, Bonham County. So Bonham County is covering the public health services for Yankton right now. So when they come in and they need a service, we have an internal referral process in place where they would reach out to her, or when she comes on her scheduled day, would take care of those appointments.
What are the scheduled days right now?
So we just did the split September 1st, and so that's something that we're kind of working through to determine what the workload is here, what the needs would be, and what days of the week would probably be best to be here to provide that service. The other thing that we do offer through public health is phone and virtual services. So through COVID, that kind of pushed most of our clients to prefer the phone appointments, and to be honest, that's probably what has stayed. So even though there may not be physical presence in your office for pregnancy care, they're being provided by phone. And the immunizations then are being scheduled, and Tracy Smith would come over and complete them in the office here. So it's a matter of us on our side, WIC and Community Health. So we're working at a referral system so that all the needs are being met. If the client comes in and says, hey, I need WIC and I'm the public health nurse, I'm going to do what I can to make sure that they get referred to the other side. And the same is gonna happen for WIC over to public health.
My concern is, you know, like I said before, a mother comes in with her kids to get WIC services. It used to be, well, let's get your vaccinations for school right now. Now they can't do that, and that young mother has to take another day off work and bring her kids in again to get it just seems like we're going from a much less capable system than, and I know it's not your guys' decision, but it certainly doesn't seem like it's a good idea from our standpoint, and I don't know.
So
I think we probably understand the situation, and we have nothing to do with it. We won't be able to have anything to do with it, so we're wasting our time arguing about it, talking about it.
Yeah, this is
Anything else anybody wants to ask about this?
This is a state-run system, right? The county has no obligation, so what, you know, what's stopping the counties from just saying, you know, no, thank you, and you guys handling it? I mean, that might be a better solution for us, because I tell you, I've gotten numerous complaints already, and people think it's the county nurse and that we made this choice. We had nothing to do with it, but yet we get the complaints. And I just don't think that's fair, and I hope if there's changes in the future like that, that if we are partners, we at least get consulted. So, thank you.
I think the four of you have heard what we're thinking, and I don't think we need to beat it anymore, so. Unless anybody has any specific questions, let's move on.
Thank you.
Can I get your name, ma'am? I'm Julie Dykstra.
Thank you very much for
Yep.
coming.
Appreciate you guys.
Thank you, guys.
Brian, next on the agenda is the Register of Deeds Quarterly Report.
Thank you, Mr. Chairman. Thank you, Commissioners. I'll just give you a few of our numbers from the third quarter. We had 325 birth certificates issued, 337 death certificates, 66 marriage licenses. We recorded 228 deeds, 136 mortgages, 138 mortgage payoffs. We filed 336 county liens. We collected in the third quarter 77,835, and there was 39.4 million in real estate sold in Yankton County in the third quarter. A lot of our numbers were down compared to the third quarter of 2022. We did see a significant increase in marriage licenses. They're up about 30% from a year ago. But a lot of our numbers are a ripple effect from the real estate market, and the higher interest rates have really cut into some of the mortgage activity. We've seen some nice sales, but the mortgages, for instance, third quarter last year we recorded 216 mortgages. This year it's 136. So that's almost half, and I think it's a direct reflection of the interest rates going up. As far as the collections, I mentioned 77,800. Approximately 27,000 of that was collected in July, 28,000 in August, and about 23,000 in September. So that's kind of an overview. If you have any questions, I'll try to answer them.
I have a question. How much do those 336 county liens total?
Well, I haven't added those up. I could do that for you for the next report.
I'm just curious.
Yeah, Patty could probably help me with that too, but we work kind of in conjunction on the county liens.
Are those mechanics lien, or county liens? Is that somebody doesn't pay ambulance bill and we put a
Right.
lien on it? That's what, okay.
Our legal counsel.
Yeah, that was quite a few liens.
And just general poor relief,
Mhm. Yep.
medical bills.
Wow.
Sheriff warrants.
Yep.
Wow.
Those have really
So,
have been up the last year or so. Probably not a great indicator as far as a financial indicator.
Mhm. I'd move approval of the Register of Deeds quarterly report.
Second.
Motion by Dan, second by John. Discussion?
I thought you had him, Wanda.
I can hear better out of my left ear.
He is closer.
All in favor, say aye.
Aye.
Opposed,
Thank
the
you.
same, motion carries.
Appreciate all you do for us.
Preston?
Well, good evening, everybody. So I've got a few things, just some discussion stuff, but first we'll just cover the quarterly jail report. You guys all got a copy of that. We did get resolved the ICE and BIA stuff, so we should be seeing some money come back in because they owe us a bill yet, so.
So I said, they don't detain anybody anymore, do they?
Yeah, so we weren't housing them until we got that fixed. Sounds like it got fixed, so it should show up on the next quarterly report, hopefully, that they'll get a payment for that one, so. But otherwise, if you had any questions about August, September, October,
Move approval of the report. Are you done with the report?
yep, yeah.
I'll
Move-
second.
Motion by Dan, second by Wanda.
No, that was Ryan.
Hey. You're mad when he doesn't give it to you. You're mad when he does.
Ryan? Second by Ryan.
Sure, yeah.
Okay. All in favor, say aye.
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 Opposed, the same, motion carries.
All right, that was easy, all right. Real quick, I just wanted to update, I did hire a new jail administrator, Todd Brandt. Had left and went to Mount Marty University as a campus safety director there, so best of luck to him. He did an excellent job for the time that he spent at the sheriff's office. But I was luckily able to find a replacement, and I will introduce Stephen Luke. I've known Stephen for quite a long time. He's been a certified law enforcement officer for the state of South Dakota for just about 15 years. And he was the sheriff in Turner County before I took him from Turner County. So I'll let him do a little introduction real quick, and then I got more stuff to talk about.
Hello, my name is Stephen Luke. He basically introduced me, 15-year police veteran, did 15 all in Turner County and then 6 years as a sheriff. So I look forward to working with all of you. I appreciate you guys entrusting me with this job as well as Preston. Look forward to providing a positive and safe environment in the jail for not only the staff but inmates. So if you ever have any questions, give me a call. I'm more than happy to meet with somebody.
Welcome.
Welcome.
Thank you.
Welcome.
Appreciate it.
So yeah, we were really excited to pick up Stephen, so. All right, next one on, now this is just all discussion stuff I wanted to bring up. So Kellerland, I don't believe Amanda's here tonight. But there's a thing, part of the Sheriff's Association, they brought this up. Kellerland has an employment hire link, it's kind of like an Indeed type thing. And there's no action tonight, but being part of the Sheriff's Association, based on your population in your county, we would have to pay $149 a month. I've called around to different sheriff's offices. They've had a lot of great success with Kellerland HireLink. They get more local people. Just an example, I talked to Sheriff Haar in Davison County. He had a jail administrator position open up at the beginning of the year. I think he only had like 5 applications and he had it on Indeed. Just recently, he started utilizing the HireClick with Kellerland, and he had an assistant jail administrator position open up, and he said he got 17 applications for that position. So they're kind of more local targeting, but they do use a lot of resources to get people's interest, and they send the resumes and cover letters. The good thing about this is that for the $149 with the Sheriff's Association discount, any county department can utilize the process of the HireLink. So essentially, you'd set up an account, somebody send you a cover letter and a resume, and then you can just go online, click it, and say, we're going to ask them to come in for interviews, or you move on. So, but any department can use it. So the highway departments, EMS would be able to use the same thing, it's just one flat rate with the Sheriff's Association discount. So I'm not asking for an action, but I think it's just something to consider.
They can do an action if they wish,
Yeah.
because it is on the agenda.
Oh, okay.
If we're already paying for it, it just makes sense to.
Well, we're not
paying
utilize
for it
We're
yet.
not paying for it yet, no.
Yeah, but I mean, it seems like a good idea to give it a try.
$1,800 a year.
So highway department can use that?
Yep, yep, anybody, if you hire for a new county nurse.
Are you short any deputies at this time?
We are currently short, but we plan on bringing some up from the jail. The jail is probably where we need the most applications. And we do have some good employees that are there that we'd like to promote up, but we won't move them up until we have the extra staff in the jail. So that's primarily.
So the short answer is yes, you're short deputies.
Yes, well, yeah, the deputies in the jail, yeah, mostly, yeah.
How many short certified law enforcement officers do you have?
I think currently, with Stephen leaving, now we'll have 3 openings, but we're in the process of a background on one that's already certified, so, which has been good, but yeah.
You just need a motion to use Kelloland Hire Click for employment, seeking employees. I could make that motion. It seems like a good idea. Let's give it a try and,
I'll second it.
you know, thank you.
Dan made the motion and Ryan seconded. Discussion, all in favor say aye.
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 Opposed the same, motion carries.
Appreciate that.
Will you contact them?
Yep, I'll get a hold of Amanda.
Are we able to send out maybe something to the department heads too and say, let's
I've
utilize
sent
this?
an email
Okay.
out to them, and they all sounded very excited
Great.
about using it.
Yeah, and like I said, I called around to all the sheriffs
Yeah.
in the state, Brown County, they've had a lot of success with it, so.
Let us know how that works in maybe 6 months or so.
Yeah.
If you would, I'd
Oh, yeah.
appreciate it.
So your next quarter.
Yeah,
Should I
yeah, I'll
push
bring it
it
up
up?
in the next quarter. Yep, that'd be good. Just another thing I wanted to bring up. So there's some positive today. So I did renegotiate the Marshall contract. I know a lot of the commissioners I've talked to, privately about, but we're gonna go from $70 a day for the marshals to $105. So I got that finalized. Which is they gave me a third and final offer at $95, and I called around to the other agencies that do marshal contracts, and I thought that we had a good thing going here in Yankton County, so I wanted to build off that. So I held out for that extra $10 per inmate, and so they came back at the table and we got it $105, so that was a good deal. It's be a 4-year contract, so I think it was good for the inflation market that we were going to get something. Instead of nothing. Now, that brings me to the next point with currently to the jail, we can house up to about 120 inmates. We're right around 97 based on our staffing. And the thing that I've noticed the most is we are holding more local people on crimes. That's not allowing us to do as many as marshal holds. So to date, today we have like 22 marshals and we can house up to 40 per the contract. But for Yankton County holds, we have 38. The Yankton Police Department has 28. South Dakota Highway Patrol, we have 3 in there from their charges. Held for out of state, because sometimes people extradite on other people, so we'll hold some people. We got 2 there. Bond home, we're only holding 1. And majority of the time for bond home, we hold the females because they have their 6-bed jail that they probably won't let go because of the needs for jails. Turner County, we're holding 1. And then we have 1 that's currently in custody for intake that's gonna go to Union County. But out of the 97 total, we are only holding 22 marshal holds. But we have 97 currently in the jail, and based on staffing, and that's why the hire Lincoln, I think, would be able to get those, more employees hired on.
Out of the number of locals, is that, you seen any increase with the increase in homeless? Is that affecting the numbers of
Yeah,
in the jail?
I can't speak specifically to that, I guess, but I can tell you that, you know, with 24/7 violations, with the state getting less lenient on some things, we'll do parole or probation holds for the state. We don't get any money from the state for the
Yeah.
probation holds.
Yeah, that's an important point that you bring up, so when somebody's on probation from state prison and they do something wrong, or parole, yeah, correct me.
Parole from
Parole
prison.
From prison.
Probation is what, before you get to go.
Thank you for correcting me, and they do something they shouldn't do, we have to house them, and we get nothing for it, so we're basically housing state employees, and we have to pay for that, so.
Now, the state legislators did pass for Department of Correction holds for parole holds. Now we can at least get $95 a day for them. It used to be, I believe, $70 a day. So state legislators did do something for parole. Probation, though, that's, you know, we see a lot of holds for them, but.
What
so-
city inmates do we have?
What's that?
City inmates? Why would we have city inmates?
Well, because they still get charged with a state crime, but we just divide it by who brings them in.
Oh,
So
you
the
mean Yankton Police versus?
Yep.
Okay.
Yep.
And then how many highway patrol ones was there, 3?
3.
Can you ask them to do that in Clay County next time?
Yeah. Yeah, 1 mile to the.
Yeah.
to the
Clay or
east of
Turner,
here,
right?
Yeah. So I just bring up those numbers because that's just something I think, you know, with me renegotiating the Marshall contract to bring in some extra revenue, you know, the jail can only hold up to 120. And we don't want to be at the max all the time because we have to have a cushion. In the winter times, you know, crimes kind of go down. Summertime it picked up. But I've noticed a lot more local holds, you know, YPD or the YSO or the Highway Patrol bringing our own local charges, so. So that was just something to think about. And then jail medical costs, I want to bring that up, because currently, I have some numbers here. So I got a letter from Avera Medical Group. They've been graciously working with the sheriff's office in the past. I think when Yankton Medical up by Walmart, what was that one? Specialty Clinic?
Lewis and Clark
Yeah,
Specialty
Lewis and Clark
Hospital.
Specialty. They had done a contract with the Yankton County Jail, and they were doing $220 a week. So it was 1 day a week, Wednesdays. Doctor would come in and do the visits. When Avera bought them out, Avera was graciously doing the, you know, we'll give you benefit of the doubt, do the $220 every Wednesday, and they see about 10 inmates. Well, I got a letter that's they're going to discontinue the $220 every week, and starting January 1st. And they said they're still willing to work with us a little bit on some stuff, but they're going to go up to $1,800 a week. So I know that I know you guys are getting hit pretty hard with medical tonight. And I don't know who did the agenda and why I had a caboose here, but.
He left.
Yeah. So. Yeah.
So what is that gonna be, over 100,000, I'm sure?
So, currently, we're getting away with about 11,400 a year. It's gonna jump to 93,600. And that's just for 1 day a week. And, you know, they're the private sector and they could probably maybe make more. And we, you know, I expected it to go up, but it just jumped a lot more than anticipated, so.
Yeah. And that's not, you know, that's just so the public knows, we didn't budget for that because we didn't know it was gonna happen, and we're just gonna have to find that within our budget.
What are the best options on that?
So I am exploring some different possibilities. We talked to Horizon Healthcare, some of the clinics in town again, and the staffing issues is what, you know, they can't service hardly their own. It's gonna be hard for them to come in and staff some of the jails, so
What about a nurse practitioner?
Bingo, yeah, so I've shown some interest with maybe a nurse practitioner where they can do their own scripts. They don't have to be overseen by somebody, by a doctor. They can do their own thing. So I am exploring, and maybe the next time I come to the commission that I'd open it up to applications to take some bids from some nurse practitioners, maybe in the community or wherever, that see what kind of services we can get. And I think what was fair is like, you know, $50 or $60 an hour for a nurse practitioner. And so, and we do currently have Jerry Sorbel. He's a retired nurse. We do have him come in, and he actually fields a lot of the inmates before they have to go to the doctor. So he's the filter. So we could have, you know, we'd like to try to get 2 days a week maybe, because medical is just medical. And
Sure.
so, like I said, I'd hate to be the, you know, the
Bearer of bad news?
Yes. And be the last person to talk about medical tonight, unless somebody else in Sundance Ridge Road wants to talk about medical. But so I budgeted next year an extra $15,000 on top of what was previously budgeted for. So this letter came after the budget was completed. So, but just something to keep in mind.
Did you have something on juvenile detention center?
Yes.
And it's painful.
Yeah. So
More bad news?
yes, with the rising costs of juvenile detention, and this week was a pretty hard. Well, the last couple weeks have been pretty hard for juveniles in Yankton County. Right now, I think we budgeted, or you know, Sheriff Hawkes had $175,000 in the budget last year. We have $43,000 left in the budget last month. I'm waiting for the next report to come out. So, with that being said, the last couple of weeks we took a hit with juveniles, and I know for a fact there's 3 that were family members. You know, I won't get too much into it, but 2 of the 3 are on Department of Corrections already, and they have to be held up in a juvenile detention facility until they see a judge. And so $458 per night, I believe that's the cost. And you have 3 juveniles going up to Sioux Falls. What was the cost on that? That was close to $19,000. So just for almost the 14 days, it's going to cost the county $19,000 to house them up there. So.
For the citizens at home, you know, juvenile detention, that used to be a state responsibility until they decided it was too expensive, and now the county's got to pay for it. So.
Yeah. Now, we do get some reimbursement from the Department of Corrections, but we have to file that to get the reimbursement back.
That's pennies on the dollar, isn't it? It's
Well,
it's very, very, very
Compared
minimal.
to $458 a night, yeah.
It beats zero.
What's that?
Beats zero.
Well, yeah.
But not by much.
Yeah, not by much. You're right.
So, you know, I've reached out to the surrounding sheriffs because some counties have similar issues as we do, but they're not as heavy populated as we are. So it's my fear that somebody's going to have to figure out something or a solution at some point to see if it's even cost effective to have our own juvenile detention center. It's unfortunate, but when it comes to, you know, the safety and security of the public, and, you know, Senate Bill 73, which is a juvenile reform, that it kind of puts you in a tough bind.
How long have the parents of that family with 3 been in this county?
They're not even around. That's why we're holding them as long. So, you know, broken homes and stuff like that has a lot of contribution to it, but
Yeah.
it's a very sad thing, and
It is.
so I reached out to Sheriff Howe over in Clay County. They would be interested in some kind of a juvenile detention, but again, it's got to be cost effective for us. It still may be cheaper for us to send them to Sioux Falls. But I think that I owe the taxpayers an opportunity for us to at least look into the possibilities of if we can make it work. If not, that's something that we just need to consider. And so Sheriff Howe was nice enough to send me what he currently paid in juvenile detention center costs since 2019. In 2019, they had a big year. They had $58,000 for Clay County, which is much smaller than us. $58,000 is what they paid. Then in 2020, it was $42,000. 2021, it was $65,000. Now, I don't know, and maybe Clemish, State Attorney Clemish do they do JDAI over there? Do you know? No. No? Okay. So, well, there you go. I didn't know you guys were over there. So, but they did drop in 2022, so I don't know what happened there, if it was, I don't know, so it was 20,000. And then year to date, now they're back up to 31,000. And I think his budget was 35,000 a year, is kind of what they budget for. You know, Juvenile Detention Alternative Initiative, one of the other acronyms that I had to remember. It's done a good job because it's kept some of the juveniles out of locked facilities that probably don't deserve to be locked up. But at some point, you know, if you guys want me to be tasked and work on some of this stuff, we're gonna have to owe it to the taxpayers to figure out if this is gonna be a cost-effective way moving forward in the future. And I have talked to Sheriff Maggs and Bonholm, and I know Hutch, you know, Sheriff Waltner up there, you know, the Turner County. At some point we'll have to talk to maybe Union County. They don't want to pay $4.58 a night, you know, maybe we can figure something out over here. But just moving forward, I just think it's something that we have to have a discussion about, because it's only going to go up and the population's getting bigger, you know.
Wanda, are you aware of any company that could come and like evaluate the area we're talking about and give us like a feasibility? I think that's probably what we'd need to do, is some sort of feasibility study and estimate, like what would the cost be to put that place into compliance to house juveniles? Is that kind of what you guys are thinking too, or?
Which place into?
Well, like, were you talking about over?
You mean the basement of the safety center?
Yes, yes.
I'm not aware of any company that does
Okay. Like a feasibility
studies.
study? Okay.
But it's unfortunate that we have 4 or 5 wards out at HSC that are locked wards that we can't utilize. Because they're there, the beds are there, they can segregate the children. They're locked away from the adults.
Sounds like a regional opportunity.
Julie, would you know
It sounds like
anybody we could
something that
contact
the
to-
governor would have to approve.
Okay.
And I don't
It's
know
a good
that
idea.
that would happen.
And I believe that the jail will be paid off in full by 2025, is that right, or?
Nice.
So,
That's a huge I'll just take a second to celebrate. That's a huge accomplishment, having that whole safety center gonna be paid off in the next 2 years. I mean, that's should be a pretty proud point. I know Clay County has built, what, 44-bed jail, $44 million.
yeah.
Wow.
Each inmate gets $1 million bed.
Yeah, exactly.
We've recently attacked some of these issues by making a smaller size task force to look into it and look at opportunities. Would that be of help to you?
Yeah, I mean, any way I can help. I think that, you know, with the connections with the surrounding counties and the sheriffs, I work really well with, and maybe it's something that would be cost effective. You know, do I really want a juvenile detention center to be overseeing? Not really, but if it's something that we can strategically get ahead, and kind of like when Dan was talking about the jail, you know, my predecessors planned for the future. Like I said, they could have ran a lot more Cat 5 wire in the building, but beggars can't be choosers here.
Yeah,
So
yeah.
I think at least allowing me, you know, to kind of do some digging to see how we can work as a regionalized thing, like kind of what Sioux Falls is doing, but it just kind of takes a little bit of a push to get things going. If it doesn't make sense, it doesn't make sense, you know. I don't want to put that burden on the taxpayer, but, you know, if we're housing adults right now for surrounding counties, you know, because my predecessors planned for the future.
Well, part of the problem is you can't legislate good parenting.
Yes. And we're only gonna see more.
Not that I'm blaming the parents necessarily.
No, yeah. Yeah, sometimes it just happens.
So are you asking us for,
Well, just
to just move forward with something?
Just a
or-
discussion,
Yeah.
if you guys feel, I know that Wanda was working on a strategic plan on how to do that, and, you know, at maybe the next meeting, You know, do we do a vote on a 5-year strategic plan or a 3-year? But I know how strategic plans go sometimes. They don't go according to plan.
Yeah.
So, no pun intended there, but I just want to get the ball
Okay.
rolling. I think it's a discussion that
Yeah,
needs to be.
I think it's a good idea.
We'll put it on our checklist of things to do.
And I did,
Right, Wanda?
and I did,
Yeah, I'm looking for the better parenting.
and I did budget.
I'm all about that.
Yeah. So I did budget, you know, for next year, $369,000 for juvenile detention. And I think with the $458 a day, that would barely get us 2.5 kids year round up there. And right now, I believe we might have 5 or so. I don't, 4? Yeah, we just brought one back today. So 4. Okay, so.
Okay, thank you.
Any questions for me? I do have one positive thing.
Yeah, good news. Yeah, give us the good news.
Yeah. I did look at, the state does have a program called AVEL, and it helps with mental illness holds. So instead of us going to a scene, if somebody's going through a mental crisis, you know, we're not always looking to put them in the state hospital if they do take them. But now we're able to utilize a tablet that the state does provide, so there's some positive from the state here. That they do provide this service for free. We don't pay anything for it. If a deputy goes on scene to a house and there's a person that's going through possibly suicidal thoughts, they're able to present the tablet. They talk to a nurse through the AVEL program, and they're able to make a safety plan. We don't necessarily have to do a committal on them and send them to the hospital, the ER, to get them medically cleared. They say that they're about an 80% success rate on that. So we just showed staff on Monday the program. So I got no results for you.
So I'm going to make one last comment.
Yeah.
I think, you said something about something positive. If we look at our world today, our United States today, and even our South Dakota today, what you do and your team does in this city is a very, very positive influence.
Thank you.
You're welcome.
Yeah, we try to hold the office with the highest honor because we feel like we got the best agency in the world, so we're gonna keep battling. So I appreciate the nice comments. Yep. All right. Well, thank you very much.
You bet. Thank you.
Yep.
Gary. Oh, do we have to?
I have one rezone tonight. Applicants requesting a rezone of a parcel that's dual zoned in rural transitional district and moderate density residential district. And we want to change that to moderate density residential district per Article 18, Section 1809, and Article 20, Section 2003. Said property is legally described as the west 538.5 feet of the south 370.28 feet of the north 489.28 feet, lying adjacent to Planks Addition and lots 15, 16, and 17, and Planks Addition as platted in Book S7, page 77B, all in Section 4, Township 93 North, Range 56 West of the 5th Principal Meridian, Yankton County, South Dakota. E911 address is 2605 Deer Boulevard. And this is first reading. The applicant is here if you have any questions.
Anybody,
Don't
have
we
any
take public
questions?
comment?
Hearing none? We'll move on.
Well, did we open it up for public comment?
Yeah.
Okay, I didn't hear, so.
I guess I do. Quickly, one question on this is that, we do have on this, I was looking on this property, it's the whole property that's being rezoned?
Yep.
And it's also, it looks like there's about 20,000 square feet of outbuildings to it. Is that something that we want for moderate density residential, or is that?
It's only, yeah, it's really small acreage though.
Yeah, it's 11 acres, but yeah, it's like, that's quite a bit of outbuildings for a, you know, I don't know, like, are we opening moderate density out, like, too much, you know?
Yeah.
Yeah, I know, it is, it's all pre-ordinance as well, 'cause it's,
And I get your point, and it's like, what do you do in our zoning ordinance, since it's dual zoned, they really have the choice. So technically, it really is, you know, moderate density already, but RT is so restrictive that you have to.
well, it's,
you know,
or is it, or should we have it, is the better zone a low density, being it's an
Yeah.
11-acre plot or something?
I don't know if
But
that.
That's really
I
the
think-
issue, is then you get into the spot zoning
Yeah.
thing, that there's no low density around it,
Exactly.
and
But
they
then also,
usually discourage
I think
that.
the other question too, I think I heard this in the planning and zoning, there was a reason, there is a specific reason to go to residential, right? Is it, there was something about having another residence on there?
They currently have, and she can answer
Yeah,
that too.
yeah, that's what I was trying to understand, I guess.
Yeah.
Maybe
I think
come
you
up
have to come up to the,
mic, yeah.
the podium
Come up
for
and
our at-home
introduce
audience.
yourself.
Yeah.
Welcome.
My name is Gina Brandt, and I live at 2605 Deer Boulevard. So the property, we've been there for over 20 years, and we live in the main house, which is more closer to the road. And there, my husband has done a lot of planting of trees and bushes, and we just want to build a retirement, a small little cabin for us to retire at the back. He says he won't leave unless he's in a coffin from that property. So I'm trying to negotiate with him so we don't have to leave. That's all.
Okay, yeah, I was just, I was just trying to understand the whole.
Sure.
All the
And then our
details around
son
it, yeah.
is a partner in our business, and he and his family would live in the larger home up towards the front. We're partners with him. So,
Okay,
any other questions?
no, I think that's it.
Okay, thank you very
Thanks.
much.
Okay, then on to item 11, building permit system discussion. Harry? Dan, can you get those lights?
Yes.
Just one of them, maybe? Yeah, thanks.
It's on.
Hi, Harry Redmond with District 3. Gary just asked if there was a way that ARC Online can assist his office with building permits. And the reason why we looked at ARC Online is because the county already has it. Paul with Emergency Management bought it many years ago for disaster mapping. I kind of run it for Paul. We integrated 211 and a disaster response mapping system. And so the theory and the layout of it is pretty much the same. You generate a form, people fill out the form, they hit submit, it creates geographic data, and then on the map, Gary can go in and, you know, look at information. He'll have access to the floodplains, any other layers, just right there. So what I'm going to do real quick is just kind of show you how the flow would work, and how he would interact with it. So right here, this is a website from a town in Virginia. They utilize the same application. So when you click on your link, and you'd have 4 separate ones. So you'd separate your conditional use, your variance, and your building permits, and probably your address requests. But when you click on it, you just get, you know, questions that the applicant has to fill out. Now, this is all 100% customizable to how the county wants to ask their questions. And then down at the end, you know, there'll be places where they sign, you know, the signatures, the dates. You can also upload attachments, so their building site plans and the signatures would all be there tied to the GIS point. So I know that Gary mentioned something that there, you know, is it the right to farm, plus some other acknowledgements that you would put down there at the end. And then once that's submitted on a map that Gary would have, all the colors would be different, you know, a big, bright, obnoxious red one for a new one coming in, and then based on whether it's completed, in progress, the colors would automatically change. But, you know, you could just go down, you can click on floodplains, click on your point. If I can click on it. That probably froze up on me.
Yeah, that computer needs to be up.
Well, so when you click on your points, you get the other information that comes on. Turn some other information on.
Right, it looks really similar to what we have now.
So down here, you know, you start to get your information about your building permit, so the building the garage. All the information that you know, the applicant puts in would be at the top, and then Gary would put his information in below. You know, he inputs his fee amount, sends the bill off, so you'd still collect your fees. You know, and then down at the bottom, you would have, you know, just a list of all the attachments. This is just an example that I pulled down. That's why all these fields are, you know, don't really make any sense. But it's just an example of how you would interact with it. If there's other layers that are sensitive for zoning, those would just be over on the other side, so then he can turn them on, turn them off as he's making his determination. And as far as the, you know, with the applicant information, you'd have the email address, phone numbers. So if you have to contact the applicant, you can just do a copy paste on the email address. We can put in webhooks so things can automate. It's just another piece of software that has the potential to break. But copy and paste is pretty darn quick also.
And Harry, it would save all of these building permits digitally, right? So we'd have a
Yeah.
copy to review, like, okay.
Yeah, every time you create a new building permit, it would generate a point on there. One thing Gary can do is he can go in, so if he notices that's a building permit for the shed, he can actually move the GPS point to the location of the shed. You know, if it's a deck, he can move the point to the deck. So then you start to get more precise on what that building permit is for. You know, and there's a dashboard that can also be generated with this. If I go back, another example, one that we built in here. Didn't spend a lot of time on it just because to build one, it does take a while to get it all, you know, functioning with colors and everything that you want. But the dashboard would still be pulling from the live data that comes in. It's just all that information displayed differently. So this could be used for the planning and zoning board. So you get a location of all the building permits, variant, you know, what's going on in the county. You know, obviously that's your choice if you want that out there, but so whatever information you are collecting, you can display there on the sides and down at the bottom. So it's just another way of tying everything together. Like I said, Yankton County Emergency Management is paying for this software. This is not a District 3 software. I just administer it for Paul for disaster response and mapping. And his goal was to get other departments utilizing it. So I know Paul is behind having other departments utilize it.
Harry, is this the software we used when we identified all that damage in the 2019?
Yes, it's
Okay.
it's the same.
And that was
technology.
super helpful for us to turn in all our FEMA grants, because they had it with the iPad, where they'd take a photo and it was GPS located, and it just saved a ton of time.
Yep, yeah,
So-
it's just running
Yeah.
right through the software the county currently has.
So, and the cost of this is?
Well, you're already paying for the ARC Online.
Sure.
Our office wouldn't receive any compensation because, like I said, I'm part of Paul's
Sure.
emergency response team, and we manage it for him. So it's, if we manage it for him, we'd manage it for other departments.
So free?
Yeah.
That's the best news I've heard all night. Yeah. We should have started out with you. So.
Yeah.
Okay. Gary, what's your thoughts on this, since you'll probably be using it a lot?
Yeah, basically, we know we have some work that we have to do on it to get it finalized, but overall, it's gonna cover what we cover in the current building permit process. And, you know, like you said, the big difference would be that it's included in our annual fee versus having to pay extra for it, so.
So we would keep the beacon stuff till this is up and running, and then do a transition?
Correct.
So we will always have a system that's operating? Correct, okay. Are you ready for a motion, Mr. Chair, or is there?
I was gonna ask Ryan to address it.
Yeah, okay. Yeah, this is the first really I've seen it, so it's like, there's a lot of questions I have actually. And I think, part of this though, I'd like to see a little bit more, I'd like to have a little more time to really investigate into this, and look at it and how it would work together. But also, I think also we should allow the beacon, because I think a lot of these features are also found in the geo permits from beacon as well. So I think we should have be able to have a side-by-side.
Yeah,
But we're not gonna, I don't think we make a decision tonight, because
Well,
we should have it side-by-side.
I think we can't ask Harry to go and spend all this time to build us a system and then say, well, we're not gonna go that route. I guess with me, I think District 3 is great. This is shopping local with them. And I guess I make a motion to adopt the District 3 building permit system. We're still gonna keep Beacon until we can transition. But I think this is where we need to go. We're saving, nearly $10,000 just by this one act, and that's what we need to do.
Wait.
Yeah.
Okay.
If I'm understanding, this is gonna replace Beacon? And isn't
The
what,
permitting system.
But
Right.
then, so the nice thing about the geo permits is that it ties in with beacon, that directs,
so will
that
this.
equalization works well.
So will this, though. But this is more for Gary's office, right? For the
This would be
online
geo
building
permits
permits.
portion
Yeah.
of it.
Yeah, yeah.
But I agree, I mean, Ryan, we have no issue with
And
going
also
to
just
District 3
yeah,
and
but-
going
yeah.
through this.
But, okay, but one also thing too, is like, you said that it's gonna save $10,000?
Well, what is, we got that email from that lady today.
About
This system-
$7,400.
$7,400.
7,400, not
Yeah,
10,000,
70 well,
7,400.
But they're
That was the
also gonna.
renewal for,
Yeah.
that's a 3-year renewal.
And when
on
we
geo
had it set
permits.
up, they also charged us $25,000. And so our
That was a
average,
one-time fee for setup.
average cost is, if you average it out over the last 4 years, has been around $12,000
But our
a year.
forward cost for the next
Yeah.
3 years
Yeah.
is 7,400 per year, not 10,000.
Yeah. But, okay, 7,400 a year. And we
7,400
need to
per
save
year.
every penny we can, because, I mean, you just saw that the sheriff's going up
Yeah, I'm very aware of the
$100,000.
reports. I'm
We
very
got
aware of the
a
reports.
chiller coming up.
One at a time.
I'm just saying,
$150,000, so Why wouldn't we save the money if we can?
Dan,
Work with
I'm
District
telling you that what I am suggesting is that we actually get a side-by-side comparison, rather than jumping into another product or jumping into another system without actually really evaluating them.
So what do you propose? He builds an entire
No,
system
I'm not
for us, or
supposed,
what?
I'm not, I didn't propose him to build anything. I proposed that perhaps we should wait to see what Geo Permits has to, in comparison to this. Because
We
I
already
feel,
have their system. That's already set up. We've been using it for a couple of years. You're talking about the system we have now?
and everything that they have,
Yeah.
everything
And we
seems to
pay
be doing.
$7,000 a year for it, where this is free.
It's-
And we have somebody local who can do it. To me, this is a no-brainer. I guess I don't understand why it's as an opportunity for us to save.
Well,
a
I'm
huge
gonna
amount of
tell you
money
something.
and
I don't
to
buy
work with
things,
our
I don't
local
buy things on the
organizations.
first 5 minutes I see them.
Okay, let me, I think we understand, Dan's point. You need a little more time to,
Yes, I really feel like we should be.
How much time do we need?
Well,
Well,
for-
we're in no hurry, so yeah, I agree. There's no issue with comparing the two and making sure that it works, that everything works that we need to have work.
I mean, I've just seen a short demo. We really haven't gotten into any details. There could be things that we missed in this very short demo that we don't know. There's no reason we shouldn't have a hurry to jump into this. What is the hurry
Well,
to jump into this?
I guess what I'm saying is we keep what we have now. We have Harry build his system, okay? When the system is up and running, we make the transition. The reality
No,
is
no,
what
what
we're
you're
gonna
saying
have to.
right now, Dan, what
Can I
you are
finish?
saying-
Mr. Chair, may I have the floor? What I'm saying is, in all likelihood, we're not gonna have this up and running before the first of the year, right? So we're still gonna pay that $7,400 to the software we have. But in the meantime, we allow our partners at District 3 to get this system up and running, which should be more than enough time to transition. And then when we're ready, we make the move and we save taxpayer dollars in doing it. I'm
Dan,
not
what you-
suggesting
Okay.
dropping the hammer tonight and doing it, and if it came off that way, that's not the intention.
That is
O-
exactly
okay,
what you
I'm
said, because what you
gonna-
said is it's a year plan to say, go out and build it, and in a year, it's gonna be implemented regardless of whether it's successful
I
or
don't
not.
think, that's not accurate.
That's what you did say.
That's
That's
not
what you
what I
did
said.
say.
Well, I
am
was just
saying we
asked
should
to,
compare them, and we should have
Yes.
a little bit more investigation than a short overview.
So what do you propose? How long do you want to continue paying $7,000 that we don't need to pay? A
At
year,
least
2
we
Aren't
should
we
be
years?
paid
doing
up
our
for the
homework,
year?
Dan.
So, no, I'm asking you, put
we
a
are,
date.
it goes
hold
to
it,
the
hold
end
it,
of
hold
the
it,
year.
hold it, hold it.
That's why I was asked to just look at options since it was ending, the agreement was ending, and this was just one of the options.
Yes, and that is a good idea. Anytime you're looking at renewing, you should take a look. But we should, us here, I've only seen that, and that's not enough for me to jump on board.
This has been displayed before. I mean, they have a good
That's great,
system,
that's great.
and I think we need to look into this more.
That's great.
Anytime we can do a cost savings to the county, it's worth looking into.
Well, I'm
We-
not disagreeing with you there. I said we would look in, I say we should look into it more.
Okay, let's,
But I say we should
let's,
look into it more, not jump into it.
let's set a time frame to make this decision.
So I got one thing to add here. So the Beacon, the contract runs out at the end of the year, and we gotta pay another $7,400 on January 1 to continue Beacon.
Well,
So what?
the geo permits, not the big
Yeah.
website.
Right, okay.
Just
So
the
two separate
permitting
things.
portion.
Okay. But, so we need to have a decision made before January 1st. Because
If
we're
you-
not gonna pay another
Exactly.
$7,400.
If you did say, if you did listen to Dan, it wouldn't even be implemented by January 1st. And so you'd still have to pay,
3 weeks, 3 weeks to a month.
He's saying he could have this done in 3 weeks to a month, so. to
and if it
John's point,
isn't,
you could
and
do
if it
that.
isn't, and then we have to continue, I still think this is a little bit of a rash decision to jump systems on a 15-minute presentation.
Okay, we've heard both sides. Wanda, do you have anything to add? John, do you have anything to add?
Other than I think we need to put a timeline
Exactly.
on one or the other.
And regardless, you have to give a 30-day written notice, so just to let you know, per agreement, so.
I agree, if Ryan needs 2 weeks to look at this system or whatever to study it, that's fine. We'll have another meeting in 2 weeks, so.
Yeah. Put it on the agenda for next meeting and make a decision.
Dan, you do have a motion out.
Yeah, I'll, you know, I will withdraw it, and if you need more time, you know, that's fine. I didn't mean to push forward with it without a plan in place. The thought process was keep what we have and then implement this other one so there'd be a seamless transition. So do you have clear guidance then, or do you need, are you two gonna get together and?
I would like to, yeah. Like I said, this is the first I actually knew what product was going to be even presented tonight. So now I know what I can go and investigate in, and I think I have your contact information here. And yeah, if I need to, if I have questions, I will. Yeah, I can stop by and ask questions and take a look, and a little bit deeper look.
Yeah.
Okay, we got a plan.
Okay, will that be enough time for you to get something done by the, okay.
Next item on the agenda, ambulance quarterly report. Eric.
Thanks, Harry.
Yeah, thanks.
Thanks, Harry.
Thanks, Harry.
Hey, Eric.
Good evening.
Evening.
Good evening.
I guess I will step into the worm bucket of medical for tonight. Going on 4 months into the new role, just wanted to give you an update of quarterly reports. I did send out a packet for you. I'm not sure which packet you actually have up first. I know
This one. It's the first page.
so the first one is actually showing you total second crew volume by hour of the day, which is just showing that no one schedules an ambulance, you know, and so the timing of a lot of our calls we're starting to utilize our second crew quite a bit more often. So it's just showing our volume is maintaining. However, the number of calls by month varies significantly. I have in the packet a total number of transfers per month, and it shows 100%, and then a number of 45 at the bottom of that scale. One of the concerns that was brought forward to me is the number of transfers we're doing for the hospital system here. That number is actually down a little bit, and there's a couple different reasons for that. Number one is staffing. Number two, the total number of our calls have dropped, and those kind of reflect hand in hand with each other. I have had a couple different conversations with staffing at the hospital to work on remedying the transport components of that. And we were working on that. Total number of transports by month, July, August, and September. You can see July we had 133, August it dipped a little bit to 113, in September it tapered off significantly. We were actually below 100 calls per month, which looking back historically, that's quite impressive because we typically average at 130-ish almost across the board. But that's where the transports also dipped a little bit. Currently, we're sitting at, from January 1st through October 31st, 1,216 transports, and that's out of 1,936 calls. And so our call volume is probably going to end up at that 2,300 mark, where we've been kind of sitting the last couple of years. We're on pace for 2,400 this year.
Eric, looking here, in the past, I know we had pickups, I guess, by location. Do you have those, like, by chance? I mean, what's in the rural area, what's in the lake area, what's in the city? I know sometimes we go to Nebraska as well, or out of county.
Statistically speaking, 92.5% of our call volume is within Yankton City, Yankton city limits, within the zone area immediately around Yankton.
Yep. 57078 zip code?
Yeah. Yep. Wanted to give you an update of some staffing. We lost one of our full-time medics. He took a position over in Sioux City, Jerry Weber. We wish him the very best over there. He was a huge asset for us. We didn't lose him completely. He's still on part-time and he's still picking up shifts to help us out, which is nice. But that leaves us short one of our full-time medics. We were looking for another full-time medic even with him in place, and we were fortunate that Alan Gary, one of our EMTs, passed his paramedic exam. He has started as of today in his field training with us, and so hopefully by the first part of the year he'll be out on his own as a medic, and so we'll still be looking for someone to backfill his position as well. Back in September, I believe Troy was here as I was in New Orleans and asked for permission to hire a full-time EMT. We went through the hiring process, did some interviews. We picked out a candidate, and upon offering them the position, they turned it down due to the pay of what we're offering for our full-time staff right now. We have had a couple part-time folks that have applied. Problem is they're part-time, so they're still leaving some gaps, but we're going to bring them on, and we're still in the process of looking for a full-time medic and some more full-time EMT staff to help us out. With that being said, I had a conversation with John earlier today. Just give you a heads up, our part-time EMTs make $15.26 an hour. Our full-time staff are right about $17 an hour. And as I was traveling from the State EMS conference out in Rapid City, we stopped in Vivian, and I have a picture on my phone if you'd like to see it. They're hiring a gas station attendant for $22 an hour. That doesn't take a whole lot of training, a whole lot of knowledge, and it's not 24/7, 365 in the organization that we work. And I know that the long-term plan for me was we need to fix the billing to sustain that fiscally responsibility for us, and then start looking at increasing. With us not being able to retain and recruit very well, I'm going to ask for a little bit of assistance if we can bump some of that up a little bit. Looking at maybe $1.50 an hour for our full-time staff, and even our part-time staff, the first out trucks. So we might be able to be a little more competitive when it comes to recruitment and possible retainment. Just crunching numbers quick this afternoon after visiting with John about it. It's going to increase our budget probably $45,000 to $50,000 a year just by doing that buck to $1.50 for the number of staff and the way that we operate trucks. So ask you to consider that for tonight. Speaking of ESO, or speaking of our billing practices, we fired Quick Med Claims back in the beginning of August. As of November 1st, all of our stuff is completely done with them. The door is shut. We realized that they were not a good fit for us, and in visiting with some billing specialists out at the State EMS conference, we're not the only ones that are kind of jumping off that ship. I feel that they did not do us any justice and cost us way more money than we probably should have allowed. Unfortunately, through the contract, there's not a lot we can do for it. But like I told my staff, there's a reason the rear view mirror is very small and the windshield is very big. We're going to focus on moving ahead and forward and try to make very minimal knee-jerk reactions, because knee-jerk reactions can get you in bad positions as well. We're going to continue pushing ahead. Brenda and Lisa have implemented the new billing software, ESO, and we've picked up a company that helps with that process, and I think it's going to be very beneficial in the long run. One of the things I did learn in visiting with some outside billing specialists, one of the things that Yankton County has not done over the last number of years is bill for consumables. And so we're going to expand that line. So I put it into practice as of November 1st. We've started that practice, and so I think we're going to be able to start recuperating just roughly probably a couple tens of thousands of dollars annually for that. Now, unfortunately, not to jump ahead, but I was looking at some information for the AP Triton stuff today. Being new to the organization, I went back and looked at billing. I don't remember if it was 22 or 21 or 22, but we billed out just over $1.6 million in medical bills and expenses for people that we encountered. Because of insurance companies, the reimbursement, the contracts that they have, we actually recuperated about $680,000 of it. It's just the nature of the beast, and I've explained to John as well as some of you I've talked to, ambulance services are not really designed to make money, and it's just an unfortunate thing. And if you'd bring in a private corporation, they would look at those numbers and be like, yeah, no, we're not touching it. And so it's a service that we're providing for the constituents of Yankton County. I know that we're very concerned about budgets. However, it still is a service, even though we're trying to rivet the business component of it and make it a little more sustainable, if that makes sense. The assessment group, AP Triton, and we signed a contract with the county and along with Yankton City. That kicked off in September, and as of October 23rd, they actually released the Dropbox for all the information that they needed. In visiting with several of you, you've said if we need to hire or bring people in extra to get that work accomplished, please make it happen so it's done in a timely manner. Unfortunately, here's how it works. Wanda, if I was to come into your office and try to do your job, I would just sit and ask you questions all day long and you would get nothing done, and it was just easier for you to do. The same thing goes for my staff. They don't have access to a lot of the data, and they would be asking where they need to find it. As of today, so I'm 2 weeks into it, I have almost everything in that they need that I'm aware of. I'm going to reach out to them by the end of the week just to make sure to see where they're at and go from there, but it took me just under 2 weeks to get all that information in. So I think we're ahead of the game, and I think we're sitting well. However, keep in mind, they said it was going to be a 4 to 6 month process, and so I will be as transparent with you as that information comes back of where it actually sits and where they direct us to go. Do I have any questions, comments, anything I can answer for you folks?
Oh, pretty good job on getting that done in 2 weeks. That's a task.
It's a haul. You know, I had some help from both Patties at the office a little bit, and Troy has been a tremendous help with me, and then the billing ladies at the office have done a little bit of pull on that as well. So getting used to the job and the overall operations. I know that your want is to have a Cadillac service, and I hope to get us back there. Unfortunately, right now, we're kind of paying for a Chevette. So we need to kind of consider that just to be a little more comparable. And I know that it's a marathon. It's not something that's going to switch overnight. We're still providing good service to the county. We're not going to change that. And it's going to take some time to get us right back down the tracks where we need to be.
Chevettes get you there too.
Yeah.
Yep.
They, do they have any public meetings or anything scheduled with the Triton group?
I have not heard, I've not received any information from them, but I will gladly make sure that that's public knowledge and allow all of you to have access to
We
it.
probably need to maybe schedule just an update with those guys and see, because, you know, we do have a timeline for that. And we need to make sure we're staying on schedule, so. Thanks.
Thank you.
Thank you.
And by the way, I think you're doing a great job, so thank your team.
Yep.
Thank you very much.
Need a motion for the report.
Make a motion to approve the ambulance quarterly report.
Second.
See who gets it.
Motion by Dan, second by John. All in favor, or discussion, all in favor say aye.
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 Opposed the same, motion carries.
Favorite son.
Jeff. Feels like you got that chiller working right now.
Yeah.
It probably is on right now, actually.
If it stays 40 degrees, we won't need it. this summer.
Yeah, it was running yesterday. I just brought Jay Nelson from Johnson Control to talk to you guys about what we're looking at, possible costs, possible timeline on different things, and if you had any other questions on the Sourcewell contract and things like that, so.
Is
this thing high enough? Thank you for the time tonight. My name is Jay Nelson. I'm a representative of Johnson Controls. I didn't necessarily prepare anything formal for you guys. I know that you guys have been discussing this. Dennis Evans, our mechanic, was here at last month's board meeting as well, or commission meeting, I should say, and talked about the need for replacing the chiller condensing unit at the building. And so speaking with Jeff, you know, I understand there's questions. It's a lot of money. My plan is to stop by Hobby Lobby to see if they have any condensing units in stock. But my guess is no on that. But as far as approximate cost, please don't hold me to this. But we did just kind of crunch some numbers and keep in mind equipment prices, things like that are volatile. They change quite often. But putting together an estimate yesterday, again, we would need to refine electrical numbers, piping numbers, you know, the install cost, the crane, the rigging, you know, all of those types of things that go into a project like this. I think we're going to be looking at right around 120,000 right in there for that replacement. That's, again, a budget figure. Could be a little bit higher, could be a little bit lower. That's on the piece of equipment that we have spec'd right now, but that's not final by any means. It's not a proposal. And so that's kind of what led to our discussions, and just maybe a brief background is my position with Johnson Controls is more of a resource, a partner to help with long-range planning, budgeting, different things like that. It's primarily what I do with a lot of public entities, school districts, counties, city governments, things like that. Obviously, being in business, they're a good partner of ours, and we want to be a resource and help out so that hopefully you're not caught off guard with something. And so this would be an example where Dennis has been working on this piece of equipment for quite some time. We're starting to see repair costs come in, and the recommendation is to be replacing it. So the other part that I know information, whatever has been discussed, I know I've sent a lot over email and things like that, but about the Sourcewell contract, or I guess more of an umbrella cooperative purchasing agreement. I understand it's new to the county of Yankton. Not necessarily new to a lot of school districts across South Dakota, county governments, things like that. In a very hopefully broad sense, and keep in mind, I'm not Sourcewell. I'm Johnson Controls, but Sourcewell would be a cooperative purchasing agency, and there are several out there. But the idea is a Sourcewell will. They conceptualize the start of their company to be able to help public entities, help school districts through the bid process. Traditionally, you know, an RFP process is pretty lengthy. Oftentimes you're hiring an engineer to re-engineer something, advertise specs, get bids to come in, and you then turn around and accept the low bid. You've probably all been on this council long enough to where you understand that low bid isn't always the best product and getting the best result.
Jeff, did you get an answer as Sourcewell? Is that something we can go through in lieu of bidding? Did you get an answer for that one, or?
Yeah.
So, that's fine. So are you guys asking tonight to use Sourcewell for this, or I guess what's the request?
Yeah, so that we can
Okay.
go forward.
Okay. I think, I mean, I don't think we have a choice on this.
I don't either.
So if you need a motion to use Sourcewell, is that what you're getting at, or?
That's entirely up to you guys.
Is that what you recommend?
Yeah, that way it just,
Okay.
it's kind of the easy
Okay.
button for what I understand. Again, I
Okay.
haven't worked with them either, obviously,
Okay.
in the past, but.
Okay, and that's fine with us if we do that in lieu of bidding? So I guess that's the request, right?
Yeah.
So I guess I'd make a motion to use, sorry.
Do they put because we should have an amount in there for the motion? Should they just put approximately 120 or no amount?
No. Well, if we
Well,
put a
just
high
we'll
amount
have
in
to-
there, then that's what our bid will automatically be. I'm hoping it would come in lower, but
It-
what about a motion to use, this is not, just to use Sourcewell, and they'll still bill us, right? And we'd pay the bill? Would that be
Rob just
acceptable?
said we don't have to have an amount, so.
Okay.
If
So-
I could just
Yes.
recommend, just being through this process, I guess maybe more of your agreement that we can explore doing this pricing through Sourcewell, providing you a proposal that will be in compliance with Sourcewell Cooperative Purchasing. Our proposal will have the contract number on that. We'll actually give you wording for your minutes at your next council meeting or whenever we get you the proposal, that you are purchasing this under that agreement, so that you're not obligated to a price or anything right now. We're just in the budget phase. We need to refine it, and I would like to price it using Sourcewell, if that.
So you're saying that would be premature to have a motion right now?
In my opinion, yes.
Reader's Digest
What do you-
version.
Do you want us, what do you think is best, Patty? Like, do you want us a motion to use Sourcewell for a proposal, or do we not even need that?
I
So-
would have an amount for the minutes. Cause we have to have the, you know, are we gonna pay for it for this year?
Betty, I think that's gonna be decided. I think that's for the board to decide when it's basically,
We haven't-
coming in.
Once the
You just don't- Right.
We haven't okayed
So-
the bill till we get this. All we gotta do is tell them,
Right, have
go
them
do it.
probably-
Yeah.
Go do
Yeah.
it and submit the proposal
Yep.
to the commission. That's what
Yep.
we're
That-
doing.
that's what we're
The
doing.
process of Stockwell.
Yeah.
That's the process that we're gonna be utilizing.
Yep.
And I
I'm
think our
fine with
que-
that. I'm fine
and our
with that.
question was before was that can we just go ahead and do this without doing like open bidding or anything like that? And that's exactly it. So I think we're at the stage, get us a proposal.
Go do it.
Yep.
Go do it.
Thank you,
That's
guys.
what we're after. All right, thank you, guys.
Thank you very much.
Any other questions?
So there's no motion then?
Nope.
No.
Dan, you wanna?
Uh,
Thanks,
No,
Jeff.
yeah, I'll withdraw any motion if I did pass one out.
Next item on the agenda is Sundance Ridge Road District. Patty.
We did have an election on October 13th for, the Sundance Ridge Road District. And do I, just the end total? That after the, voting, the counting the ballots and, the total was 8-8. So the, election did fail.
That was a much more rapid item from the agenda than it's been for the last 3 months. Okay, canvas of the Volun Rural,
I do need a motion that, cause I'll put it in the record.
oh, okay.
That the, Sundance Road District was defeated.
I move to put in the record that the Sundance Road District was defeated.
I'll second.
Motion by Wanda, second by Ryan. Discussion. All in favor, say aye. Aye.
Aye.
Opposed, the same. Motion carries. You can put your name on the thing back there and be on public comment. Thank you. Planning Commission and Board of Adjustment bylaws for canvas of the Volun Rural Fire District.
And this was held, October 26th, and it was a unanimous total, 25-0, to form the Volun Fire District.
Move approval.
Second.
Motion by Dan, second by Wanda. Discussion. All in favor, say aye.
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 Opposed, the same. Motion carries.
Congratulations to you guys.
Next item, diversion update.
We skipping number 16?
bylaws.
I skipped it.
Maybe we could get some of these employees out of here and do this later.
I have no issue moving it down. I'm here
We can
anyway,
move it
so.
down, I think that's
Yeah,
a good
let's
idea,
get,
Dan.
let's get some of these guys out of here so they don't have to wait around.
Okay.
Oh, yeah,
On to 17, diversion update.
we'll come back to that.
I believe that, Dan, the correct motion is, I motion to table that.
Yeah, I think that's,
I moved to table item 16.
Second.
Motion and a second.
Just-
We'll come back to that at the end of the meeting.
Yep.
So, we are not here with bad news, actually. So here you go. Alec is going to take the first part of this.
Thank you, guys. Alec Martin, Diversion Coordinator for Yankton County. So first, I'm just going to kind of go through the programs that we're doing. So right now, just the juvenile diversion program. We have 44 juveniles in the program. Just a few examples of the charges: MIC, possession of tobacco, disturbance of school, possession of marijuana. Right now, there are 2 juveniles that are on our conditional release program, and what that program is when there's a big offense committed by a juvenile, and then they are taken into custody, and there's a ray, and then depending on what they score on the ray is when they will then go to detention. So that's just an example of how we can, we have that program to keep juveniles that don't need to be in JDC here in Yankton still. Right now, with our out-of-school suspended students, they're coming to my office. We have made a schedule with the Boys and Girls Club for 9 to noon until they hire a JDI coordinator over there. And then the Yankton County Diversion Program just received $7,500 for all of the successful diversions for the reporting period of July 2022 to July 2023.
how many was that?
It's not the dollar amount varies, but let's put it this way, we got 4,100 last year.
And so there's not a set dollar amount for each?
No, so there's a pool of money for the state, and then it just is divvied out to each county. And then another program is our truancy diversion program. Right now, we have 12 families in this program. Just some things that we're doing in this program is, going to doors, just knocking on the door and waking up mom and dad to make sure that we can get the kid to school. I have a work cell phone, so I feel like a hotel front desk receptionist making the wake-up calls in the morning. And then, if there's refusal, going with law enforcement to the house to get the kid out.
Is that the police or the sheriff's office, or both?
Both.
Okay.
Both. And then we're working very closely with that program with the systems of care at Lewis and Clark Behavioral Health, just to try to make sure that all the families' needs are being met, including buying gas cards and phone cards for those families. Just trying to do whatever we can to help get those kids to school. And then our young adult diversion. So there were 17 young adults in the program since August 2023. Offenses there include MIC, traffic violations, petty theft, possession of marijuana, paraphernalia, and then tobacco. And then this link right here is to an article that was in the P&D about this, and the title of the article is "The South Dakota Task Force Young Adults Need Special Attention from the Courts." So just, there's a big push right now. So I think that this is a very important program that we have as well.
Alec, a young adult, is that 25 to 18?
Yep, 18 to 25.
18 to 25.
Mm-hmm. And then we have our simple assault diversion. This is just specific for simple assault charges. 11 individuals have participated in this program since August. Possible requirements for these individuals are a chemical dependency evaluation at Lewis and Clark, participation in the 24/7 program, conflict-wise, which is an online class, and then community service hours. And then we have our felony diversion program. There's been 4 individuals that are currently participating in the program. Requirements for these individuals are chemical dependency evaluation from Lewis and Clark, community service hours, participation in the 24/7 program, and then an online class depending on their offense. And then transportation is our biggest issue that we see throughout the programs. A few options that we have, and I have it right here, is a contract with Yankton Transit for the program to try to help with, where we'll use those diversion funds that we're getting and pay for the individual if they're in our program to ride on the transit, and then we'll be able to do same day rides with them as well.
So this would come out of that 7,500 we
Yep,
get? Okay,
yep, yep.
That's a good idea. I like that.
And then I know there's been some discussion about possibly sharing a county vehicle. And then we've been in discussion with the Boys and Girls Club to try to see if we can utilize the van that they have. And then also talked about reaching out to other nonprofit to see what kind of transportation they have to offer as well.
Alec, is your biggest issue mornings or after school, like where you need to get, is it getting them to school bigger than transporting them after school?
I think it goes hand in hand because there's multiple families that are like, well, the bus can take them to school, but I have no way to get them home. So I would say that I can't speak on one is more of an impact than the other. I think they go pretty hand in hand when it comes to that.
On a daily basis, how many students or kids do you need to transport to school or from school?
I would say the average is probably, because we're not just going to go pick up any kid. We're only going to use in the ones in our program. So I would say the average is at most probably 4 a day. I would say it's it would be a very rare occasion if it was over 4.
Okay. So the bus option I think would be ideal, because your time is valuable too, but I know that might not work for everybody.
Well, and the problem is transit, they are on hold. There's a waiting list. They're taking no new school riders at all. Yankton School District will transport to school. They do not transport from school. And so Yankton Transit is willing to do that for our office, but they already have to be riders because they're not taking anyone new. And they are down 4 drivers right now. So unfortunately, we're probably gonna have to look elsewhere for transportation because both transit and the school district are kind of already packed.
And then the last thing I wanted to touch on is just some community partnerships that we're utilizing for our community service hours with the individuals in our programs. So work very closely with all of these. So just wanted to touch on those as well. But any questions?
Is there any word on the person that might be taking your previous position?
I do not have an update on where they're at. I know that they've been interviewing, but
We interviewed again today, but I don't know how it'll go. There wasn't an interview today.
Yeah, I knew that. Thank you, Alex.
yep, thank you guys.
And so the other thing we have, and I thought I sent it to Patty, but we received those opioid funds. We were able to get in on that settlement. Lewis and Clark Behavioral Health is willing to perform the services that are required to receive those funds. And so we got an MOU. It models the MOU that Lewis and Clark is using with all the other counties where they provide services. Again, the good news is it doesn't cost the county any money. It lists the funds that we got last year. There'll be a disbursement this year. I don't know if Patty's gotten it yet. And then there will be one more in the future, they haven't actually said that it will be 2024. But what this MOU does is it will just filter the funds from the county directly to Lewis and Clark for them then to put together their programs. So we're just a pass-through for these funds. So Don, you'll just need to sign a copy, and then if you want me to take it out to Dr. Stanage, I can do that, or if you want to do it yourself, but then just get it back to Dr. Stanage. He needs,
Probably get there faster if you do it. I'm pretty immobile right now.
I can do that.
Deb, we don't need a vote because we already approved this, correct?
Correct.
Yeah.
Yep.
Okay, that's what I thought.
And that's all I have. Thank you.
Next item on the agenda is the bike grant.
Yeah,
What's that?
can I get a copy of that when all the signatures are,
Once Dr. Stanage, I can get a copy and bring it back to you.
Do you know what the bike grant is? I don't know what that is.
Is that the trail to Vermillion, between
No,
Vermillion and?
that's the flap grant.
That's gonna be the flap one, okay.
oh no, it's just on, the last meeting for things to be on the commission meetings.
That's probably the one in the same then.
Let's just X
Yeah,
that.
that is, okay, so that is.
Moving on.
No action, moving on. Flap grant.
Well, we had a meeting last night in this room, open to the public. We had a few people attend, and basically, it's a federal land access program. Just looking from the commission if we want to apply with Clay County for a grant. All it is a study to look at access points. So did you have anything you wanted to add, Gary? And then John's attended a couple of those meetings as well. It's not very exciting at this point. It's just looking at doing a study.
So how many people showed up last night?
There was about eight people,
So,
Does that include you?
including me, yes. There wasn't a lot. Clay County did theirs, and I want to say they had between 30 and 50 show up to theirs. So a lot of the, people went to the first one, and then we had one person from Clay County come here last night.
so, the grant's gonna be written majority with Clay County.
Clay County has the lead
Really leading
on
on
it,
it.
and Southeast, what are they, Southeast? Southeast Council of Governments has taken the lead on it, and I believe it's December 15th. And so, if we're in agreement to move forward, we'd need a resolution at the next meeting to do that. Is that correct, Gary? Or- Yeah, so I'd say the next meeting, we'd have a resolution to do
So
that.
they want to build, for lack of a better phrase, a bike trail from Vermillion
No.
to Yankton along the river?
That's not really accurate. Basically, they're just looking at access points. What they found, it's a federal park, and they found if you want to kayak, for example, you can put in by the city park, but the only place you can get out is Myron Grove, and I want to say that's 13 or 14 miles. So if you're going to kayak, you're going to do a 14-mile trip, or you're not going to do one. And the thought is, hey, let's look and work with willing landowners who want to have access points, and so that's what the
Yeah,
grant is about.
the flap grant is is a grant to help create accesses for two federal lands.
You're exactly
Only
right.
to federal lands,
Yes.
which is the only federal land that we have that qualifies in county is all just the Missouri River.
Yep.
There, so.
You're exactly right.
It allows you 10 miles.
And it's a
buffer-
10-mile,
buffer
yeah, it's a
zone
10-mile
to-
zone. It has to be
Yep.
within 10
Yep,
miles of
you're
it.
exactly
federal
correct,
land.
so.
You can't exceed the 10 miles, yeah. So, and we're on a resolution for next meeting then?
Yeah, what the plan was is we were gonna discuss it, and if
Or-
everybody was heck no, we weren't gonna participate, but if there's a general agreement they want to look at this, we'll put a resolution for the
Can
next
we
meeting.
do a resolution tonight?
We don't have it.
Oh, we have
They're preparing it yet.
Okay.
And so it's not ready.
All right.
So assuming that this grant comes through, is Yankton County actually pay anything?
No,
No.
we'd get, if we get approved, we'd get a is it $250,000? And the hope would be we could hire some local company to go and do a feasibility study and say, this is what I recommend, so.
District 3 is already involved
Yeah,
in some of the
yep,
planning
yep.
already, so.
Okay,
So
then the
is that a-
resolution next week, next meeting.
Yeah.
Yeah,
Is that what we
Resolution
wanna
meeting,
do, Gary?
yes.
What kind of
Resolution next
resolution?
meeting?
A flap resolution.
Flap grant.
Yeah, hopefully we'll just do it at the next meeting and then we don't have to worry about it. If it's ready.
Well, so.
Next item on the
Sophie
agenda
said
is the October 17 minutes.
She'd have the
I
Yeah.
wasn't here, so
resolution.
I'm not in a position to make a motion.
The only thing I
Any
saw,
questions on the minutes?
the only thing I saw on the meeting minutes was, action 23341C. We did a motion to invite District 3 and Beacon, and then we also allowed the imagery to be used by anybody with a free account, because previously you had to be a subscriber to do that, so that should be added to that one. And then I think the vote was different than that.
Oh, look at the two.
Yeah.
Okay,
What motion was that, Dan?
That was action 23341C.
next item on agenda is the claims.
I'd move to approve the first set of claims.
Oh,
Wait, who first and seconded the minutes? Dan?
I don't think anybody did.
No, we didn't.
We
I
didn't
think
do-
we're gonna just let it and approve the next meeting with the correction, just to make sure that,
we,
No.
did we?
No,
No,
we
we-
can approve these and I'll make the
Yeah.
correction.
Yeah, I'll make a motion to approve the claims,
With
or
the-
the minutes with the
Okay.
corrections.
Second.
motion by Dan, second by John. Discussion, all in favor say aye.
Aye.
Aye, opposed the same, motion carries.
Now, I make a motion to approve the first set of claims.
I'll
Second.
second.
Motion by Wanda, second by John to approve the first section claims. Discussion, all in favor say aye.
Aye.
Aye, opposed the same. Next item is October 20,
I make a motion to approve the second set of claims.
Second.
okay. I have a motion and a second. Discussion, all in favor say aye.
Aye.
Aye,
Aye.
opposed the same,
I abstain.
one abstention. MI quarterly report.
I move to approve the October 23 payroll.
Oh, checking them off too fast. here.
Second.
I have a motion to approve the 2023 payroll and a second by Ryan. Discussion, all in favor say aye.
Aye.
Opposed the same. MI October quarterly report.
Make a motion to approve.
Motion by John,
Second.
second by Wanda. Discussion, all in favor say aye.
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 Opposed the same. 2024 liquor license renewals.
I move to approve the 2024 liquor license renewal applications.
I'll second.
Ryan, second. Motion by Wanda, second by Ryan. Discussion,
I do have a question.
okay.
Are there more liquor licenses that get renewed at
No,
a different
this is-
time?
There's malt beverage,
But no
just
more
beer.
liquor licenses in the county?
and this is all the county can have too, by population.
Stringers doesn't have a liquor license?
Yeah, they do.
Yeah, they do, they were in
They're-
there.
Are they on here?
Might be
It's
under another.
It's under TJ's Mini Mart, is their liquor license.
Oh, okay, okay.
When, side note, when do we approve the medical marijuana ones?
That'll be in December, I think.
That'll be in
right?
December. All right. Do we do it when we do the malt liquor, or?
No, the
Okay.
malt liquor is earlier in the
Okay.
year.
Next item on the agenda is public comment.
Do we
Is
need
there
to vote?
anybody that wants?
Vote on the liquor
Oh,
license.
I thought we did. Motion and a second. All in favor, say aye.
Aye.
Aye. Opposed, the same. Motion carries. Who is it? Huber?
Lisa Huber.
Lisa Huber.
My name is Lisa Huber. I'm from 31083 Sundance Ridge. I'm part of the Sundance Ridge Road District request. There were additional votes. I know Patty said that the vote was 8-8. There were additional votes. One vote that was deemed invalid was from an individual that had planned to attend the election and was approved for that by the county auditor and the state's attorney. This was later challenged and removed. At a minimum, I feel like this item should be tabled, and we should be allowed to decide whether we want to revote.
Rob, is that an option that they have?
Is your mic on?
That's something I don't know. That's something we're in discussions right now too regarding what to do regarding the election. I don't have an answer, Don, for that. I know this is public comment, and I know it's something we could have brought up before, but I'm not sure on how to proceed. I did talk to Lisa's husband, and I said to think through what the recommendation was and what the plan was gonna be, and then we were gonna discuss it this week. So that could be an option.
Just to be clear, it's not, kind of like, it's not entirely dead anyways. It just
It's
didn't
not
pass. It could. You could still get a road district put in there. Just-
Correct.
It didn't pass this time. It's gonna take, yeah. We wish it was cut and dried and done, but it's not. It's probably gonna be a thing that we're gonna keep having to work on.
This is public comment, and we don't provide an answer. So
Thank you.
we've heard you. We'll discuss it.
I believe there's somebody else here for public comment relative to this issue.
Right here. Yes, sir. Come on up.
My name is Kevin Loftus. I'm a local attorney here in town, and I represent Bob Curry, who's one of the landowners that was against the proposed Sundance Ridge Road District. And I believe that under the circumstances of the failed vote, there's no further action that the commission can take, and that would be pursuant to 31-12A-6, which specifically says that absent a majority of the vote, the matter fails, and no further action by the commission would be taken. I believe at this point, the South Sundance Ridge Road District petition would be the only one left for the commission to take up pursuant to the valid petition that they submitted. I disagree with Ms. Huber's characterization of the vote, and I think maybe Ms. Hocham misspoke about the number of votes. I believe there were 20 votes submitted, and of those 20 votes, 5 of them actually should have been dismissed as invalid votes for, under 31, SDCL 31-12A-1.2 and Attorney General's recent opinion regarding road districts. The landowners are allowed to have one vote. And Mr. Huber voted 5 times. I think there was some attempt on his part to have his vote count as for his LLC, but the statute also requires that that he provide to the election officials a designation of the LLC for his being an officer or an agent. I'm sorry.
Prior to the vote.
Prior to the vote, yes.
And just so I'm clear, Mr. Curry's position is that this vote failed, so then you move on to the South Road District.
Correct. And then, Mr. Despite any, well, let me get back to Ms. Huber's. One of those votes wouldn't count for Ms. Huber any more than it would for Mr. Luke, because my understanding, and Mr. Curry was present through the entire election process, it was Mr. Huber that filled out all the ballots and submitted them. So it wouldn't be any more valid for Ms. Huber to get credit for one of those ballots than it would be for Mr. Luke having a proxy.
And again, just so I'm clear, so Mr. Huber gets a vote, Mrs. Huber gets a vote.
If she voted at that time, she
No,
did not.
I get that, but I mean, both landowners get a vote?
No.
Or just one per piece of land?
No, one landowner. But if there are multiple landowners for multiple parcels, then among the various landowners, they can designate one vote.
So if Mr. and Mrs. Huber own parcel A, one of those two people can vote? For parcel A?
For parcel A.
Okay, just
Yes.
wanted to
Only
make sure.
Only one vote per parcel.
Okay.
But that doesn't mean that if you have 5 parcels, you get 5 votes. You have 2 landowners that own, in their case, I believe 3 parcels, so they potentially would get 3 votes. But in this case, they didn't both vote. Only
Okay, we're in public comment. This discussion isn't allowed,
I know, I'm just trying to clarify.
so
if
Thank
there
you.
are no questions,
thank you.
thank you.
Commissioner updates. Dan?
You want to start with me? Don't really have too much. Our Operation Green Light sign is in full swing. I'd like to thank Jeff for that. Just bringing awareness of veterans and their transition in our community. Other than that, Veterans Day is around the corner, and yep, hoorah, yep. Observe it how you feel necessary. Thank you.
John?
Mike from the Highway Department and myself went to a conference in Sioux Falls last week about local roads, building and maintenance. And I guess I could say I learned a few things, but about repairing some of the gravel roads in different ways. And there are a lot of studies out there on different aspects of how to repair and build roads. So it was a very interesting conference. Some of the stuff didn't pertain to our area because they had a lot of speakers there from Oregon and Washington and around, but at the same token, I think Mike and I got some good ideas to look at and possibly look at doing some testing on some different products.
Ryan?
Yeah, so last week we did have our first fishing awareness meeting, and I just still need to go out I want to go out and meet with road department and kind of go over the same thing. It's also a great opportunity to really talk about any type of technology needs they may need, or talk about things in the future that maybe that could help them or avoid helping them. And same thing with EMS. So, I'm going to be continuing that tour this week.
Wanda?
Nada.
Okay. I did have one request that came in, and I think it's probably a good request that we should put on the agenda for the future. But somebody talked about putting signs up on the roads banning Jake breaks within 5 miles of town. So,
Do they use them on county roads?
Yeah.
I have no idea.
Rob, do you know, is that something the county can? Okay. Would you?
Is
would
it a
you-
problem?
Would you look into, yeah, I don't.
This person lives close to 314 or on 314, and they, according to him, they do it very frequently in several locations. So, anyway, I guess we're ready for executive session.
Did we want to untable the
Oh.
bylaws?
Yes, the bylaws, yes. Thank you, Brian.
So a while back, I was asked to write up some bylaws based on the Cottington County bylaws. We talked about this at another meeting, and we have a full group here this time, so it's just a matter if you want to move forward on them or not.
Well, I've read through them 3 times now, and whew, it's gonna be easy to screw up.
It's in depth. It's in depth, there's no doubt.
But I think it was well-written and well done.
Thank you.
And I'm certainly in favor of passing it. So I make a motion to pass.
I just had a few things that I saw looking through it, you know, under Article 4, the fourth one down, it talks about work sessions. And I believe this was taken out of Cottington County, whose Board of Adjustment is different than the county commission. So it talks about Board of Adjustment work sessions, and that I don't think would ever apply to us, because we have county commission meetings and then we sit as a Board of Adjustment. So then I don't think that would apply. And then if you go down there farther, it talks about Board of Adjustment executive sessions. And then again, I don't think that would fly, and you know, because the Board of Adjustments have the power to sit in executive session. I think the SDCL 1-25 talks about county commissions doing that. So I think we maybe need to go through it another time and just look at it. There are just a few of those things in there that address Board of Adjustments specifically, where I don't know if they have that power. If we look in our zoning ordinance, the Board of Adjustment can approve conditional use permits, variances, or they can hear a complaint on the decision of an employee. And those are the 3 powers that the Board of Adjustment has.
Okay, we have a motion on the table. We don't have a second.
I'll second.
We have a second now. Motion and a second. Now further discussion. I would ask Gary if those are important changes, and if you could make those changes. And
We certainly could. So just delete the special meetings and the any meeting after that on Article 4.
Yeah, I did have another one, I'm sorry to keep going, but like number 9, at the second one down, it talks about individuals not indicated on an intent to testify will be allowed to testify on recognition by the chairperson for a one-time maximum. We've never done that before, and I think that could create a huge problem if we have a room full of people, which we do have.
that's for
and
1 minute,
everybody-
right?
Well,
Isn't that?
Yeah.
specify for 1 minute?
Yeah.
So page 9?
Yeah, page 9, second down. And from what I've always been told, for open meetings, you gotta allow a minimum of 3 minutes, but here it specifies somebody who didn't have an intent to speak, but now they're only recognized for 1 minute when we normally do 3 minutes. I just think that could cause a potential problem. So, sorry to be,
Where are you seeing?
and then
E2?
it would be, yeah, E number 3, yeah, E2, and then the one below that, it starts with individuals that did not.
F, yeah.
And then I had another one, on page 10, 11E, and it says, a lack of a response by any member is assumed agreement with the question or finding read. I guess, I don't know, I've never seen that anywhere else, but that seems a little.
11E, you said?
11E and then one below
Lack of
that.
response,
Yeah,
EI.
I guess we, I kind of get that, but. And then at 2B, on page 11, motions are made to approve as presented by the staff. Now, that's generally true, but a lot of times conditions are added or there's slight modifications. So that can happen too.
And that is the correct way. If you watch that,
Yeah,
if you
yeah.
go through that, that is the right way.
Mhm.
You start with approval,
Mhm.
a motion for approval, and then if you want to add a condition, you make a motion
Mhm.
to amend. And then you approve that amendment, and then you have now a motion with amendments. And that's the process.
Mm. Yeah.
Rob, have you reviewed this?
Page 12 still, the copy I have still has Cottington County's zoning ordinance under Article 11 too.
Page
But that might
12.
have changed.
Let's see. I'm not seeing it on mine, I
Okay,
guess.
that might have been changed.
Yeah.
Yeah, I think there's a lot of good information in here.
There is none. I do
Yeah.
have one small change to it. And
Okay.
that is up on section 5.2, required items on the agenda. One of those required items should be public comment,
I2.
I think.
What page?
Page 2, 3.
And yeah, that raises a question, because it talks Article 5, standard agenda for Board of Adjustment meetings. Now, do Board of Adjustments, the way we hold them, have a separate agenda? They really don't, because we have a county commission meeting, and we go into a board, and that's why I say this particular document was written for a separate board that is a Board of Adjustment, other than the way we do it. And
Gary, you didn't hardly change our document when you went through it. It's been,
Yeah.
this is the way it's been written for.
Yeah. But yeah, this was written by Cottington County, which their board is
Which
separate.
has
than the-
separate
Dan,
boards.
Yeah.
he didn't change our original one. He referred to the Cottington County one.
Okay.
He cross-checked to make sure everything they had in it was.
Yeah, it
in
was for our ordinance, yeah,
Yeah.
but, so that was page 2, which
Yeah.
number?
It's under the section 5.2 items
Yeah.
to be included in the agenda. I think we should have that, because I think this is kind of for Board of Adjustment and for planning and zoning, right?
Yeah.
Which, in that case, you do need to have a.
And I wondered about that agenda thing too, but it is an agenda.
It doesn't actually say that in here at all, because I believe Cottington, their Board of Adjustment is their planning commission. So they don't have a planning commission. It goes just, so there are a few kinks like that in the document.
So approval of agenda scratch. Okay. All right.
I think it's a pretty good document to start working
Make those
according to,
adjustments.
with these, a few adjustments that we've made here.
I have a motion then to approve.
Yeah, you have a motion.
I
and
made
then
the motion,
You made the
you're
motion, I
seconded?
seconded it, yep,
With the adjustment, with
Yeah.
the adjustments.
yeah.
Discussion?
Changes.
For one more discussion, I'm sorry, page 6, it talks rules for the public attendance. It talks about the length of time allotted per person for testifying will be based on the number of people indicating their attendance. Before that, and I think a better way, at least the way we've done it, is we've allowed everybody the same amount of time, 3 minutes. That's worked pretty well. I'd hate to change that. Because it's.
So paragraph 2 under
Yeah,
Article 7.
Article 7, yeah,
Any
page 6.
citizen in
Almost.
attendance.
Yeah,
Almost the only time though that has applied, Dan, is when
Yeah.
we've had those 2-hour discussions.
Yeah.
and there's
Cell towers.
40
or-
people that
Yeah.
garnered in here, and they all say the same damn thing
Yeah.
every.
and I really appreciate the way you've done it, Don. As you said, everybody gets 3 minutes, and this seems to say if there's 100 people, you get less time than if there's 5 people.
But
They
that's-
get more
it-
time, and I think if we just keep it standard at the same number, then everybody gets treated fairly.
But I
think
think that's,
you
I think
have
that's
did
kind of
that in
saying
the
is that's
past.
what you do, is like when you have 100 people, you say, you set that out forth, and maybe you might
There's
reduce
five,
it.
I think it says
Yeah.
you get 5
Yeah,
Yeah.
in there.
yeah, so,
Yeah.
and I think that's part of it. And then I have read some places too where they also say, it's like, okay, public comment's great, but you can't have 100 people come up and say the same thing. You have to, at some point, you
It's the
you
chair's
don't want to
discretion.
filibuster. Yeah.
Have a motion and a second. Any other discussion? All in favor, say aye.
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 Opposed, the same.
No,
No.
I think it's got to pass by 2/3, doesn't it?
Majority.
It is majority. 2 voted no.
Two no's.
And in one.
So that's traded 2 at once.
Okay, Gary, I guess you get to talk to Dan and Wanda to see what they want to do
Yeah.
to change it, send it out again, and we'll all read it again.
Okay. You can send me notes. Sounds good, thanks.
I move that we go into executive session for personnel and litigation
Second.
issues.
Have a motion to go into executive session. Do I have a second?
second.
Second by Dan. All in favor, say aye.
Aye.
Aye. Opposed, the same. Motion carries. We are in executive session.
You too.
Okay, can you bring that one up and then just go ahead? Okay, after we're done. Okay, thank you, because there's a dollar amount. Is it done? I see your caregiver showed up like an hour ago. Just reminding you, Chairman, that we can speed this up a little bit.
Hey, that's pretty impressive. Unanimous vote. That's the one you guys too rough on that Department of Health.
Thank you.
So where do I get the dollar numbers for the opioids?
It's on the contract.
I know, but
Under the agreement part.
I'd entertain a motion.
I'd move to go back into regular session out of
Second.
executive.
Have a motion to go back into regular session.
Second.
Second by Dan.
First, I.
Discussion. All in favor, say aye.
Aye.
Aye. Okay, first I'd like to go make a motion to approve the allocation of the opioids funds received annually for 2022, $7,344.14. For 2023, $7,718.33. And at a yet-to-be-determined date, the additional sum of $7,718.33.
Second.
A motion by Wanda, a second by Ryan. Discussion. All in favor, say aye.
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 Opposed, the same. Motion carries.
And I'll abstain from that vote.
Okay. I would further make a recommendation to pay CWMI 23-03-09, CWMI -23-3010, CWMI 2303-11, and CWMI 23-03-12 in the aggregate amount of $3,318.
Second.
I have a motion by Wanda, a second by Ryan. Discussion. All in favor, say aye.
Aye.
Aye. Opposed, the same. Motion carries.
I have a further recommendation or motion to deny payment of CW 23-4-05. Do you want the reason why? No? Okay.
Second.
Motion by Wanda, second by Ryan. Discussion. All in favor, say aye.
Aye.
Opposed, the same. Motion carries.
Make a motion to dismiss.
Second.
Items for next meeting.
I think one of the items for the next meeting is the Beacon versus second thing. The one the guy they came for today.
We're talking about geo permits
Geo permits.
by Snyder Court.
Building permit system like
Yep.
we have this one.
Yes.
And then we
We'll-
had Brian and Doug saw insurance and
Flap grant.
resolution for the flap grant.
Flap grant, yep.
Yep.
Move to adjourn.
Second.
Motion and a second to adjourn.
We
All,
already got John and Dan.
You lost again, Wanda. Aye. Aye.
Call for the vote.
Aye.
all in favor, say aye.
Aye.
Opposed, the same. Thank you, guys.
Thanks, Don.
Thanks, Don.
Did we get everything signed?
Yep,
So you're leaving when?
I got you, Don.
Tomorrow.